So I think it's time to get started. It's 5 after 1. Is everyone up in Carson City okay to start?
Absolutely.
If we could, Mr. Hager, if you could, I'll call this meeting to order of the Consumer Assistance Advisory Committee meeting of the Silver State Health Insurance. This meeting has been properly noticed, and with that, I would like to welcome everybody. Do we have anybody on the phone who's joining us? It doesn't sound like that. I'd like to welcome everybody in Las Vegas, everybody in Carson City, and everybody watching live stream on the web. And with that, if we could have Mr. Hager take the roll.
Mr. Downey.
Present.
Miss Ellis.
Here.
Miss Joyner.
Here.
Mr. Mazzoni.
Present.
Mr. McCoy.
Here.
Miss Periotti Boothman.
Present.
Mr. Rodriguez. Appears to be absent. Vice Chair Lewis. Also appears to be absent. And Chair Atkins.
Present.
Madam Chair, we have a quorum.
Thank you very much. Prior to public comment, Mr. Hager, do you have any announcements?
Not for the beginning of the meeting. I've got plenty of announcements when we get to the various items, though.
Excellent. It sounds like somebody joined us on the phone. I'm just wondering if that's any of our committee members. Okay. With that, and I will probably have quite a few comments as well as we get through the agenda. So I think I will defer those until
This is Lavon Lewis calling in.
Thank you, Ms. Lewis. If you could set your
Lavon
phone to mute.
Lavon Lewis, can you hear me?
Yes, we can.
Okay, good.
Ms. Lewis, if you could set your phone to mute.
Tyler Covey from Public.
Hello? Okay, good. Hello?
Miss Lewis, this is John. We've got you on the phone. If you could, or it sounds like you just hung up. For anybody that's on the phone, could you please make sure your phones are mute and that you don't put us on hold? As you take another call, sometimes when you put us on hold, we get the lovely music in the background. Miss Atkins, I'm sorry, go ahead.
No, thank you very much. We love our technology. So I think what we'll do is we'll start with public comment. I believe the materials which are posted on the website have 3 public comments, which I would ask to be included in the record. Are there any people who would like to make public comment at this time in Las Vegas? We have one person. Please step forward. And if you could state your name and what organization you're representing. And we are going to limit public comment at this time as well as any time we open it during the meeting today to 3 minutes per person. So I would ask staff to keep time. And that's not because we don't want to hear from everyone. We just want to give everyone an opportunity to be heard. But we do also have a lot to get through on the agenda today. So with that.
Lavon Lewis back on the call.
Thank you, Ms. Lewis.
My name is Michael Ginsberg, representing the Progressive Leadership Alliance of Nevada. That's GINSBURG. And members of the committee, we're pleased to have the opportunity to comment actually on the design of Nevada's Essential Health Benefits package. At this time, we'd like to draw the committee's attention to the need for an essential health benefits standard that does not promote arbitrary discrimination against any condition or class of insured individuals, and that ensures parity in coverage for medically necessary essential benefits across the 10 statutory categories of essential health benefits coverage. In particular, we encourage the committee to do what it can to ensure that Nevada's Essential Health Benefits benchmark does not discriminate against transgender Nevadans by incorporating arbitrary coverage exclusions specifically targeting the transgender population. We also urge the committee to recommend to the Silver State Exchange Board staff to make more comprehensive information on benchmark plan exclusions available to the public through the Silver State Exchange website to promote a robust opportunity for informed public comment on the essential health benefits benchmark selection process. I raise these concerns today for several reasons. One, of course, transgender people face significant health and healthcare access disparities across the nation. Second, insurance discrimination against transgender people is rampant, and we have a number of specific examples that I could give you from Nevada health plans. And lastly, but not least, of course, the Affordable Care Act and Nevada state law support equal treatment for transgender people. To fulfill the coverage and equity aims of the Affordable Care Act and to ensure compliance with federal and state non-discrimination mandates and to provide all Nevadans with a minimum standard of comprehensive affordable coverage, we ask this committee to recommend the following. Apply the federally mandated exchange non-discrimination protections to any plan required to cover the essential health benefits, including those in the individual and small group markets outside the exchange. Eliminate condition-based exclusions that lack sound clinical basis, including exclusions targeting the transgender population from the state-selected EHB benchmark plan, and prohibit any arbitrary condition-based exclusions, including those that unfairly discriminate against transgender people in plans based on the EHB benchmark. And at that, I believe my time is probably running short, so I thank the committee for listening, and I'll answer any questions that you might have.
Thank you for your comment, Mr. Ginsburg. I just want to make sure that you're aware that the Plan Certification Subcommittee is the subcommittee that will be making recommendations on those issues to the Silver State Health Insurance Exchange Board. So I want to make sure that you also get those comments in front of that subcommittee.
Absolutely, absolutely.
Thank you.
Seeing that this was the Consumer Assistance Board, we wanted to also bring it to your attention as well.
Thank you. I appreciate it. Public comment in Carson City?
Yes, hello. My name is Eric Schoen. I'm the Executive Director for the Human Services Network. It's a privilege to be before you this afternoon. For those of you unfamiliar with the Human Services Network, we are a dynamic collaborative of health and human service providers from throughout the Truckee Meadows and beyond. With over 40 members serving more than an estimated 500,000 Nevadans annually, our mission is to create connections, share information, strengthen providers, and support and advocate for good public policy, thus assuring the provision of quality human services in Northern Nevada. In regards to today's agenda, I have two specific remarks, and both of these have been submitted online, I think posted as well. So I'll just read directly from that. I believe that we need to make sure that the Silver State Health Insurance Exchange works for the clients it serves, and for many, aggregated billing would be a blessing, as it would assist them in staying on top of their health care obligations while removing the stress of having to track multiple targets. Two, I absolutely agree with what Elisa Cafferata has written in regards to who can be considered a navigator. In my mind, this means that we need to keep the restrictions for who can be considered to be a navigator as clean and flexible as possible. Firstly, this will ensure that we have a clear, bright line between insurance brokers and navigators to reduce any potential conflicts of interest. Secondly, this means ready access for consumers throughout the state, especially in rural areas, to access unbiased information on qualified health plans through a variety of pathways, including those providers with whom they already have a trusted relationship, who are, in many cases, nonprofits providing a variety of services related to health and human services. Thank you so much.
Thank you very much. There is no additional comment in public comment in Las Vegas. I see there's another person in Carson City.
Hello, my name is Stacy Shin, and I'm here representing Plan Action, which is the C4 political arm of the Progressive Leadership Alliance of Nevada. And I'm here just to make a couple quick comments, but I'm basically here to support our allies from Planned Parenthood and the Human Service Network. Today we are recommending that aggregated billing be provided to individuals as well as being provided to small businesses. We also recommend that navigators not be required to be licensed as insurance brokers. We recommend that Nevada does not preclude all healthcare providers from acting as navigators. And finally, we support the creation of the third-party assisters or the outreach specialists. Thank you.
Thank you very much. Is there any additional public comment in Carson City?
There doesn't appear to be. I'm not sure if somebody has something on the phone.
Anybody on the telephone would like to make public comment? With that, we will close public comment at this time, and if we can go to agenda item 3 for approval of the minutes. Has everyone had an opportunity to review the minutes? Any changes or corrections? Is there a motion to approve?
Madam Chair, so moved. Randall Downey.
Second, Tom McCoy.
Is there a second? Thank you, Mr. McCoy. All in favor?
Aye.
Aye.
Can everyone please go to their microphone?
Aye.
Thank you. Any opposed? All right, the minutes are approved. Thank you. Mr. Hager, agenda item 4.
For the record, John Hager, Executive Director for the Exchange. So item 4 is very similar to what you've seen in the past. It's just a summary of what's happened so far and what we have to do still. The calendar for the committee is on the second page. You can see that the board has approved a couple of recommendations. There's a few recommendations that are awaiting board review, and then there's some final review items that the committee will discuss, as well as talking today about the billing system and the complaint and appeals process. You can see 3 items there are for a future board committee meeting in the October and November board meetings. So some of these dates have been pushed back from the original schedule that was back in March, back when I'd only been on board for about 3 weeks. So we're working on this. Obviously, there is a little bit of slippage in this in this committee, as well as some of the other committees. It shouldn't hinder our ability to get the project implemented on time, and we're pushing as quickly as we can to make sure these recommendations come to the board in a timely manner. At the previous meeting, one of the previous meetings, we provided information on the regulations and information on navigators and brokers. And there has been a little bit of back and forth regarding what we can or can't require navigators to do, and we'll get to that when we get to the agenda item number 7. So the recommendations that have been approved by the board include the outreach strategy and the types of consumer services available for enrollment. And then the role of navigators, producers, and assisters, we'll talk about that again today. But generally that recommendation is ready for board approval as well. So without talking too much about the role of navigators and producers and assisters, because we'll get to that at item number 7, I'd like to open it up for any questions from the board, or the committee, excuse me.
Are there any questions on this agenda item?
This is Amber. I did have a question, but maybe it will be answered later. I was just confused why on page 6, when we did vote on a recommendation last meeting, why it was not included in this, as if it hadn't happened, but maybe it just wasn't updated.
Are you talking about the role of navigators, producers, and assisters?
Yes.
Yeah, I'll get to that at the next, at the agenda item number 7. There was some miscommunication that we've got it all straightened out, and it will go forward, but I'd like to get to that at agenda item number 7, if you don't mind.
Thank you.
Any other questions from the committee? All right, with that, we will close agenda item 4. Before we get to agenda item 5, I was told that there's some technical difficulties here at LCB is working on and my mic keeps going in and out, so I don't know if anyone else is. So just an FYI that we're having some technical difficulties that they're working on. I would also just like to say that at the last board meeting, the agenda item 5, which is going to be the presentation from Xerox, they did make a presentation at the board meeting, which I found enlightening and interesting, because it's kind of the first look that the first opportunity we're going to have to see of the portal that everyone we're talking about who's going to go through what they're going to see and how it's going to look. And I just thought it would really, really help this committee in making our decisions see what exactly they're designing right now that the consumers will see. It's actually so we can start touching and feeling it, and it's a little bit more real. So with that, I had asked Mr. Hager to have Xerox here to do that presentation. So Mr. Hager?
For the record, John Hager. So the contract between the exchange and Xerox was approved by the Board of Examiners on August 14th, 2012. Since then, we've had several meetings to kind of ramp up and start working on the implementation, making sure that all the requirements are in place. Obviously, there's a lot of requirements that are in the RFP and the resulting contract, but now we get down to the real dirty work of figuring out how this is going to work, specifically with the Deloitte eligibility engine under welfare and Medicaid, and all of the different systems that are out there that we have to integrate with. So we asked Xerox to come forward and provide us a demo of their system. This is similar to the demo that they provided during our finalist presentations and the board presentation, pared down from, obviously there are a lot of different scenarios that can happen when you go on to the exchange. We tried to focus on one of the more difficult individual scenarios, and so with that, the main reason that we're here discussing this in the Consumer Assistance Committee is, number one, so that you understand what the navigators or producers will be assisting people, how they will be assisting them enroll, and then and so you have a better idea of how an individual chooses his plans, compares doctors, compares drugs, quality, cost, etc. So all that stuff will be covered. Additionally, the question that we have before us today is whether or not we have Xerox do the individual billing, or whether we have the individual, or have the carriers do the individual billing. Under the Affordable Care Act, the shop exchange, the Xerox system is required to do billing for small employers, but they're not required to do it for individuals, and so that is the policy decision that we have to recommend to the board. Keep in mind there's a cost associated with that, and we'll get to all of that stuff in the, agenda item number 6. But for that, for now, I'd like to turn it over to Xerox so that they can go through this step by step. So, Jennifer?
Yeah, Jennifer Wadham with Xerox, for the record. Just thank you for allowing us to present to the committee this morning. I also want to introduce Choice Administrators, who is our partner and brings the software as a service solution for the exchange. The base of this solution already exists with their private exchanges in California today and has been serving those exchanges for 15 years. So we're very happy to be partnering with the state of Nevada on this, and we're looking forward to the project. I'm going to turn it over to Eddie. He's going to walk through the actual demo, and then we'll be happy to answer questions.
Good afternoon. Eduardo Garcia, for the record, Choice Administrators. I'm going to walk you through what we believe is the no wrong door portal that we are going to produce for the exchange. We have the individuals and families, employers and small businesses, employees.
Excuse me, may I interrupt for a moment? Is there going to be any graphics? Are we going to see anything down in Las Vegas?
Can you see it now?
Thank you. Yes.
Sorry about that. I'll start over. So this is our no wrong door portal. We have the ability to go in as an individual, looking also at employers and small businesses. Thank you. Employees and brokers and navigators. For this scenario, we'll go through a mixed family, and as an individual, I can go in and click individuals and families, and it will take me to shop, compare, and apply online. And this is similar to like any other online shopping experience that you would have, where you want to go and look and browse at the items that are available to you. In this case, we can click on Browse Plans. This, you don't have to log in. Just it's asking you for very basic information so that it can tell you what plans may be available to you. So in this case, the individual information is provided. We'll make up a name. Now it's asking you crucial information: your zip code, your gender, birth date, your language of preference, and when do you want to start your coverage date. At this point, you can also add household members, but since we're just going to browse, we can just go in and say Show Plans. These are the type of plans that are available to you based on the information you have provided. You can, at this point, without actually creating an account at this point, start looking at what are the premiums, what are your out-of-pocket expenses. And I'll take you to focus on the calculator on the left top corner. You can actually select what kind of primary care office visits you want to have during the time frame, and you will notice the more you add, your out-of-pocket expenses start changing. You may not want to consider emergency room visits because we can't anticipate, so at this point we can say 0 or 1, and as I stated earlier, your out-of-pocket expenses start calculating and adjusting accordingly. You may want to have a specialist visit, 1 or 2, 3, and again, your calculation, your annual out-of-pocket expenses changes. At this point, you might say, well, you know what, I like what I see. Let me add something to a cart. Now, at this point, we need a little bit more information, so the system will ask you if you want to create an account. Or if you already have an account, you can log in. So in this case, we'll start creating an account. So for the demo, we have pre-populated information so that we can save some time. But at this point, you add a little bit more information, and you can say, create an account, or by the way, I forgot to mention, we do have the capability to show that we can translate. So if you are a Spanish speaker, you can click the translation, and throughout the entire enrollment process, it'll be in Spanish. So at this point, we can say create an account. And as I mentioned, we do have pre-populated information. This is a family of 4, husband and wife and 2 children. The key information, your phone number, your annual household income, your social security number, and your household members. So you're actually building your household. We also have a roadmap, if you will. You're never lost. You know exactly where you're at during the process. In this case, we are still building our household, and we're about to submit the information. Now here, the system is going out, checking at the federal level, I believe, checking to see who you are, trying to confirm your identity. So it will ask you a couple of questions. In what city were you born, as an example? And where do you live? Now, if everything is correct, you can actually confirm. So now it's found you. It says, okay, I know who you are. Your stated income is $45,000. Husband and wife, both, one makes $30,000 and the other one makes $15,000, and your 2 children. It has confirmed at this point that you are everyone in the household is a U.S. citizen, and that you are a resident of the state. You can confirm it at this point, or if you believe that the information is incorrect, we give you the avenue to make that request and ask for a correction. But for the scenario, we'll go ahead and say, yes, everything is correct. We move on to the next step. Now, based on your stated income and household information, we are going to check eligibility of what the plans are available to you. But in order to really pin down the type of plans that are available to you, we might ask a little bit more information. Now, this particular page, we just have a very few amount of questions, but we are flexible to add anything that is required or additional, as many questions that are required at this point. For this scenario, we'll say Daniel is disabled, and none of the other questions pertain to anyone of the household, at this point, we say, let's submit. And as you see again, your roadmap tells you exactly where you're at. We're at the eligibility stage. So the system came back and it said, you know what, Daniel is qualifying for Medicaid because he is disabled. Your spouse, based on stated income, is qualifying for subsidized plans, and your children, based on the income as well, qualifies for CHIP. And at this point, we have the ability and flexibility to also provide links to non-medical services that are provided. So now that you are at the eligibility stage, you can say, okay, now I want to look at what the plans look like. As stated earlier, Daniel is handicapped, and they qualify for the Medicaid, and this is the only plan that's available to them. And as I stated in the beginning, this is like a shopping experience. Now, this is what's available to Daniel. You add this plan to the cart, and it shows up in the cart. Now, you want to continue shopping for the rest of your family. You go to the CHIP tab. Your children are both present, and your monthly premium for them is $26 based on your stated income. Then you add that plan to the cart as well. You have one more to go. You go to your spouse, who actually qualifies for the subsidized plans, and you will see that all these plans would be available based on the information that was provided. So in an example, the very first one that shows up says the premium, your monthly premium for the plan is $509, and your subsidy is $464. So you actually pay just $45. Your out-of-pocket expense is $600. So if at this point you want to make adjustments, again, look at the calculator on your top left, you can make those selections. You can say, well, I really want to visit the doctor twice a month. So you can go as far as you want, all the way to 24. Okay, your out-of-pocket expense goes up to $1230, or maybe once every 2 months. Okay, now you want to visit a specialist. You change that accordingly. It all depends on what the consumer is looking for. And as I stated earlier, your out-of-pocket calculations start changing automatically. At this point, you may choose, well, let me look at certain types of plans. We have the ability to say, well, look at all the platinum plans, so let's remove the gold and the silver, and only the platinum plans are available to you to compare. So you can select each one. There's a comparison tool that we also provide that you can look at, and the plans that you have selected start showing up on the right where it says compare up to 4 plans. We'll do 2 for now. You click compare, and the basic information, benefit information for each plan shows up. We can select gold, silver, and everything dynamically starts changing as you select. You can also select by premium, monthly premium ranges. You can also select by deductibles, types of carriers, prescriptions. We also provide the ability to look up a physician, someone that's nearby, local, or someone that you may already know. So we give you those abilities today. Or if you want to search for medication, these tools again are available to you. So at this point, you select the one we can continue shopping and complete the shopping experience, and just say, well, I want to add this particular plan. It shows up in your shopping cart. Now you can say at this point, I'm ready to go. I'm going to apply now. The system will then ask you, do you want to apply online or print it out and mail it? Now that's the initial phase of obtaining insurance. Now I'm going to take you through what the member experience is. Not when you are actually enrolled. And that would be... Could we
pause for a moment? I know there's a couple questions here, so before we go on to that next section, is this an okay time for questions from the committee?
Go right ahead.
Yes.
Great. Ms. Parati-Boothman?
Thank you, Madam Chairman. This is Ms. Parati-Boothman for the record. One quick question, or excuse me, I have several. I've written them out. Back to the very first main page, the head page that comes up. Is it easily accessible and understandable for those with cultural needs and language needs to select the different language? And I realize, I will tell you, it's a little difficult to see the specifics of the screen as you've navigated through. But to me, if there's cultural need or language need, is that clear for those individuals that will pull that first page up? So from the beginning, they're able to select the language that they need.
So this is Jennifer Wadham from Xerox for the record. Yes, the whole website, if they click in the upper right-hand corner, there's I'm going to mispronounce it, but en español.
It's Espanol.
They can click on that, and the entire website translates to Spanish. So I believe it's very clear for people with other language needs to see that up in the right-hand corner. And the graphic of that, or the font, we can play with. So that's a recommendation we can make.
Is there the adaptability for other languages besides Spanish?
So there is. Right now we only have Spanish planned, but we definitely can look at other translations.
Okay. The other quick question, several that I have. Well, a statement. First of all, I love the fact I'm a healthcare provider. I love the fact that you have a very comprehensive program. I'm of the opinion that offering medication information and primary care or physician information is significant. If there's one thing that will prevent falling through the cracks, it's having access to primary care physician information to guide these patients through their health care, as well as securing this. There is secured information, for example, I believe it was the second screen, possibly the third. Is there a statement indicating that, again, with most systems like this, I'm sure it's quite secure, but people are concerned? Is there a secured statement saying your data, your social security numbers, secured?
Yeah, this is Jennifer Wadham again for the record. We do put a statement on there. In addition, when it's pulled back up, either by a navigator, a broker, or the call center, information that is HIPAA or credit card transactions or anything like that, you blank out. We can't see the first part of the information. So for Social Security number, we would only be able to see the last 4 digits in order to verify that person. Does that answer your question?
Okay. Yeah, that does, just so the individuals are aware. If that question is asked. There, I believe it was the third screen is that, or the second is information was being input. Out-of-pocket expenses calculates or changes based on plan selection. I'm a little confused because then it was several screens later that they actually were able to select the plan. I'm confused on how that calculating.
Initially, it was just a browsing, just getting an idea without actually creating an account and actually not selecting a plan. When you're actually selecting the plans at this point, when you are actually just prior to, it's actually showing you all the plans with the out-of-pocket being automatically calculated. When you actually select it, it will take all your settings and it will transfer it over into the actual shopping cart. Does that answer your question?
I believe so. And I will say it's a good thing there are going to be navigators and brokers to help navigate people through this a little bit.
For the
another
record,
question I do.
This is John Hager, if I might add to that. So the initial time that they went through to look at plans, a subsidy was not applied to those plans. Once you enter demographic information and they have income data, then at that point the subsidy is applied so you can see the lower premium amount. And so that was a major difference in what you saw the very first time and what you see here. So the annual out-of-pocket includes both the premium, the deductibles, office visit, prescription drug, all of the costs based on that estimated calculator. And we'll have to have some kind of disclaimer on there that says these are estimates only, of course. I've got that in my notes. But that's the main difference. The first time you went through, it didn't include the subsidy because you didn't put any information in there about how much income you made. And so the system didn't know if you were eligible for a subsidy or not.
Okay, thanks, Mr. Hager. That
This is Yvonne
answers
Lewis,
that question
and
for
I
me.
just have a question on the.
Ms. Lewis, I think we lost you, or we can't hear the rest of your question. So until we establish...
I'm sorry. Can you hear me now?
Yes.
I didn't mean to interrupt, but I did not hear the explanation on the privacy issue. That was, I believe, question number 2. I didn't hear how that's handled in the system. So if they could just explain that again, I apologize, but that just didn't come through. The sound is not the best.
This is Jennifer Wadham from Xerox. We will put a disclaimer on the webpage so that the individual knows how their information is protected, as well as information that is HIPAA or credit card type information that shouldn't be shown on the second time we come into that person's record will be blanked out at the beginning, so we only see like the last 4 digits of the Social Security number or the last 4 digits of the credit card.
Thank you very much.
Are there... Oh, Ms. Parati-Boothman?
Thanks. I just have 2 more questions, conferring with my partners on this committee. The next one is, how does the portal confirm residency for the children and the spouse? We were discussing that if an individual is clicking through the screens and they just check, they're residents of the state, how is that information confirmed?
I guess the question is more, the only Social Security that I saw enter was the head of the family, I guess, who's entering the information and then automatically assume that everybody else is a citizen. How did that happen?
So actually...
And that was Ms. Ellis for the record.
So this is Jennifer Wadham for the record. I think Eduardo is going back to the family household screen. At the bottom of that screen, we had it pre-populated with the mother and children's Social Security numbers. So all Social Security numbers do have to be entered into the system. Then it goes out to the federal portal, which is being built by CMS, to verify that person's Social Security number, their address, their residency, all of that information.
And then one last question. Excuse me. Thank you. I think that answered it for us. Once all this information and plans are corroborated and submitted, is there the ability for the families, individuals, to go back in and change it at any time, or are there set times? How's that?
So for the system, there isn't restrictions against doing that. There are restrictions based on state policy and based on federal rules on when you can go in and change your plan throughout the year. So those rules will be built into the system. And Eduardo, if you can go, just click over to the My Account page so they can kind of see some of the, and this is getting a little bit more into the detail, but as a member, an enrolled member, you can go back into the web portal and go into your account and do life event changes, address changes, etc. And if allowed, you could go in and re-enroll or change your enrollment at that time.
Actually, that's the second part of my... this is Eduardo Garcia, but that is the second part of the demo.
I think we're probably... Mr. McCoy... Oh, I'm sorry. Ms. Ellis has another question, and then I don't know if Mr. McCoy has a question or not.
TV Ellis for the record. I just have one question. When you were going through the setup of that individual family, I guess the person was choosing whether they were going to have one specialist visit or more than one specialist visit. How do they know how many visits are they going to need? I mean, most patients are not aware of their future health care needs. So to forecast that, help me understand that, please. Thanks.
Sure. This is Jennifer Wadham. This is Jennifer Wadham from Xerox. What is put on the portal initially is based on demographic norms. So we recognize that, some people may have more specialist visits throughout the year than others. Generally, what navigators and brokers would be recommending to members to use to calculate that is how many times did you go to a specialist last year? What do you anticipate your usage is for the year? And this is a calculator to help them estimate out of pocket. It is not a set fee. It is not something they will be paying. There is no way to estimate what's going to happen throughout the year, but we're trying to help them see what their out-of-pocket expenses could be.
Mr. McCoy?
Yes, just a quick question. I think if we were to enroll today, we would not have instant gratification in terms of my child or verification, because of the information exchange with the federal portal. So I know the anticipation is this is going to be ready to rock and roll at some point, but I sense that there would be some concern on the part of, say, someone who is doing this online by themselves. Oh my gosh, do I have it? Do I not have it? What's your response to this issue?
So that is an issue. We are expecting the federal portal to be real time. Real time is still being defined by the federal government. However, we do want to talk to the state about alternative plans for that if real time is not available. One of the things we could look at from a consumer assistance standpoint is putting a message on the web portal of, your results will be there in 24 hours, or your enrollment is pending approval, or something like that. Obviously, we all hope that the federal portal is up in time, but we recognize that there needs to be alternatives.
Madam Chair, if I might, for the record, John Hager. So yes, the state shares Xerox's concerns. We actually have one of our questions in our questions to the feds document under the resources tab in our website. We've got a question about real-time returns and 24/7 availability. Both of those are critical to the exchange. If it is not, in fact, real-time, we are going to have to rethink just about everything. I would expect that if it's not real-time, we're going to lose a lot of individuals that would otherwise purchase insurance, and therefore we'll have to redo our estimates on the enrollment, our rates, our budgets. I mean, the whole thing has to be changed. We have to get with Xerox and work on completely new workflows. They have the general workflow already worked out for real-time, and so if real-time is not, in fact, real time, or at least 15 to 30 seconds, hopefully under that, then that will definitely be a concern. It should be, we expect the feds to say real time will be about 15 seconds. We're going to send information out there and you're going to get it back right away. But it may not be. So we're concerned about that. And then the other concern is during open enrollment, during the peak times when you have 30 million people trying to access the data hub, whether or not that is in fact real time. So we are definitely concerned about it. We have emphasized strongly that this whole thing could fall apart if it's not in fact real time, that we can still do it, but it's going to be very difficult without a real time determination.
Thank you. Are there any other questions right now? I think we're going to have a little bit more of a presentation. I do have a few questions. I'm going to hold them till the end, though. So it looks like we can go forward with the second part of the Xerox presentation.
Very well. All right. So at this point, we now are members of the exchange. We want to see our information. Give it a second. There it is. At this point, you have the ability to look at your benefits. What is it that you are enrolled? Now, again, this is all pre-populated information, where you can see your monthly premiums, monthly information. You can also look at updating your information, change of address, anything you need to communicate to the exchange. You can do it through this particular portal. You can also look at life events. Life events is a very important aspect of all our lives. We get married. We're going to have a child, having a baby. We walk you through all that so that you can include them in the insurance. We also provide the ability to look at other health-related links that may be made available to you. So this particular portal, this is your area. This is exactly where you're looking for information. We have it available to you. The other thing is, now I'm going to move over from a live to a PowerPoint mini slides, where let's say you want to pay for your premium, and one of the options is you select the credit card. It gives you the basic information to enter your account information, similar to buying something online, like I stated earlier. You can confirm that information, and you can also schedule payments, a one-time, a fixed, reoccurring, or same day. You can look at your scheduled payments and maybe go paperless. And or look at your current bill at a summary basis, and eventually you actually click on view your statement. This would be the easy way where the mixed family, as we had gone through the other scenario, you have the spouse who qualified for subsidized plan, who's the husband who is on Medicaid, and the children who are in Nevada checkup state. Here you'll notice that it's all one single invoice, one simple way of making sure that all your insurance needs are being paid at one time. You don't have to navigate through many different types of invoices from different entities of the insurance, of the carriers. So this is our biggest.
So I was just going to say, this is Jennifer Wadham from Xerox. One of the big things about integrated billing that Eduardo was showing, from the consumer standpoint, if you're mailing in a check, you're using one stamp. You're going to the post office box as opposed to running around town paying multiple bills. So one of the things that we would like this committee to consider is that this makes it easier for the individual. Yes, we're providing this for the shop exchange, but for the individuals that are paying these bills and are on public programs, making it easily as simple as possible so they retain their coverage within the exchanges is very important.
And that's pretty much the invoice part. And
Thank you. Is there more, or are we ready for questions?
Just the last.
Okay, great.
I'm sorry, just the last slide, and this is information that was already provided to the Silver State Health Insurance Exchange Board. This is an estimate that we did on the percentage of savings if you have a consolidated bill that Xerox does for the exchange, the percentage of savings that would be experienced by the carriers from administrative costs on their side. And as I said, this has already been submitted to the board for your consideration.
Thank you. Committee members, any questions? Mr. Mazzoni?
Dwight Mazzoni for the record. Am I to assume by the way you've presented this that some entity, the exchange, Xerox, or Choice Administrators is receiving these funds? First question.
This is Jennifer Wadham for the record from Xerox. Should the Silver State Exchange choose for Xerox to do the individual premium billing, yes, the plan would be for us to receive, aggregate the payments, and then we'll work with the Silver State Exchange on how those payments would be dispersed.
Ms. Ellis?
TV Ellis for the record. Can you clarify, based on this example, if you use the case of CHIP and Medicaid just as any other insurance provider, or in fact this CHIP or Medicaid recipients will be going through the exchange?
This is Jennifer Wadham from Xerox. CHIP and Medicaid recipients would be going through the exchange to choose their plan and to find out where they're qualified. The CHIP recipients could pay their premiums online, so yes, they would go through the exchange.
Ms. Parati-Boothman?
Gina Parati-Boothman for the record. One last quick question for me. It sounds like this system or a similar system has been implemented in California, at least. I recall that being mentioned. I am curious to know as to client satisfaction with regards to clarity of the information on the site and ease of navigability, whether it be a client or a navigator or a broker using this. Do you have statistical information by chance on their satisfaction with this type of programming?
At this moment, this is Eduardo Garcia for the record. At this moment, I don't have that with me, but we can probably provide that information.
Thank you. If you could get that information to Mr. Hager, that would be great. I have a couple of questions. What are the anticipated number of people that will be manning the call center that as part of the contract with Xerox?
This is Jennifer Wadden with Xerox. I can get you the specific number depending on the year of the contract. It's between 25 and 35 people.
And is this going to be 24/7 or no?
I do not believe it's planned that way in the contract. We're more than happy to do that, but no, that's not the way it's planned.
And Mr. Hager, you might be able to answer this question, and then I have just one more comment. For folks that are, once they purchase their insurance through the exchange, they're eligible for the federal subsidy. Let's say they obtain their insurance through the exchange in January, and in April they either change jobs and get a promotion, they get an increase in salary, which either will reduce the amount of subsidy they get or possibly eliminate them from being able to get a subsidy. Does that change at the time that happens, or does that change at open enrollment? Does it change twice a year? I think we've kind of talked about this going in and out of Medicaid, but I was just wondering also for the subsidy. Do we have a sense of that yet?
For the record, John Hager. So there are rules in place around qualifying events: births, deaths, divorces, marriages. I should have said marriages first and then divorces. But there are a lot of different qualifying events that can allow you to change your coverage. I'm not sure exactly what all of those events are. I believe changes in income are probably in that category, but I have to. I'm not as up to speed on that as I'd like. Actually, I think we were just talking about it at the staff level about getting up to speed on that, or I was thinking about asking the staff to look at that. I don't know if I've actually asked them yet or not. So I hope to have a good handle on that in the next month or so. The other issue is the churn between Medicaid and the exchange, and whether changes in income would move you from Medicaid to the exchange. I believe we have been discussing with Medicaid whether there is a lock in eligibility for a period of time. I'm not sure if what that period of time might be. So I guess the answer to your entire question is no, I don't know right now. We are aware of the situation or the concerns and are working on it.
Thank you. And I have one more, I think more of a comment. Many of us in this room, and I'm assuming in Carson City, have had health insurance, most of our adult lives or continuously. And I think even just listening to the questions that consumers are going to be asked going through the exchange, for those of us who have had health insurance covered, I think even the new terminology about the gold, the premium, the gold, the bronze, the silver plans, the public, even those educated aren't going to really know what that means, and they're going to have questions about definitions and things like that. Also just trying to figure out how many times you think you might be going to the doctor. I mean, I'd have to go through my calendar and look and kind of figure that out. My point being that for people, that's kind of for people who are familiar with having health insurance and who've kind of gone through the process. For people who have never had health insurance, those terminology is just completely foreign, and I'm assuming also premiums, deductibles, specialists. That I think what was so clear to me when I heard this last month is that this is what the navigators are going to be helping with. Helping people understand what these questions are, what the definitions are, how to go through this form. And so that's why I was asking about the number of people that are going to be at the 800 number, because I'm assuming some of the folks at Xerox at the 800 number are going to be helping people go through. But if you might have 20 people working at one time or 15 people working at one time, they can all only help one person at a time. So I'm concerned, as I've expressed to Mr. Hager, about the capacity of the state to be able to help everybody get through this process to get covered. So I guess I just wanted to throw out those comments. Mr. Downey?
Thank you, Madam Chair. Randall Downey for the record. I want to commend Xerox and for your presentation today and previously. I've spent 5 years with the Medicare Plan Finder, and I'm encouraged to see the system you've put forward for us to use. I do have some questions, however. This may seem, well, regardless of how it seems, will the plans be populating their benefit information directly into the web portal designed by Xerox?
Jennifer Wadham for the record. The plans will be sending through information to Xerox and Choice administrators. We will normalize that data. The plans will have the opportunity to review it before it's published onto the website. The only reason we don't allow them to publish it directly to the website is there are policies and rules that we want to apply from the state before everything gets published.
Thank you. The reason for that question was that generally that's the case with the Medicare Plan Finder, for example. Many proprietary similar systems, that's not the case, so you get varying figures for costs, co-pays, co-insurance, and the like. And I wanted to make sure that there was a sync between the benefit summaries sent out to enrollees and what appears on the web portal. If the information inputted for an individual or for a household does show up as incorrect, there will be an indication that I can't locate this person. What then? You indicated you could apply for an adjustment apparently through the web portal, whether or not that's real time. Would the call center, for example, have dedicated staff with access to the federal portal? A navigator, for example, could phone the call center and say, look, we can't bring this person up on the web portal. How do we locate and verify their information so we can proceed with enrollment?
Jennifer Wadham with Xerox for the record. We work with the state to develop those policies and how they want us to proceed with those. In general, yes, through the web portal they can request that their information be updated. Often they will need to send in proof of that in order to update federal records. We will have a process through the call center for us to override that, but all of that needs to be worked out with the state as far as policy.
Thank you. I just have two other brief questions, if I may. You also indicated you could pull up providers. So if a person comes into a navigator or a producer and is interested in purchasing through the exchange, but they want to keep certain providers, will there be a capacity through the web portal to show, for example, provider Smith is affiliated or does honor Platinum Plan B, Bronze Plan A, and the like? So you can tell, if I'm in a plan, can I keep my 2 or 3 particular providers and still enroll in that plan?
Jennifer Wadham for the record. Part of the provider search, and I'm not sure you can see the web portal now, but part of the provider search is to search by name of your provider, and it will show a list of all the Dr. Smiths in a 5-mile radius, and you can do the filters in multiple ways, but it will show you your provider and which plans they participate in. So yes, that will be available.
Thank you. That is a good improvement. And finally, one thing that's I think is important, if there are questions or clarifications that arise in looking at a particular plan, will there be dedicated staff, a navigator or producer can call either at the plan or at the call center to help explain whatever the particular problem might be?
Jennifer Wadham for the record. Yes, the call center, that's what they're there for, to help navigators, consumers, small businesses navigate through the portal and explain terms that are on the website. I can't speak for the plans and what dedicated staff they will have. The other thing I wanted to point out, and again, I don't know if you in Las Vegas can see the graphic, a user online can click on a chat button and chat with somebody live, just like many websites. They can also request a phone call. So if they don't want to talk to somebody now, or they want to request through the web portal that somebody call them, they can set up a time for that through the web portal to explain terms to them.
Thank you. And finally, my final question.
May I ask a follow-up question on that one? Is that still part of the approximate 25 to 35 people, or is that additional staff that would be able to do the online chat?
That is all part of
or the callback.
That is all part of the call center. And again, I will get you the staffing numbers. It does vary quite dramatically between open enrollment periods, which is generally October to December, and the rest of the year.
Thank you. Mr. Downey, I'm sorry.
Okay. Finally, just a brief question. Will this system be available for training prior to going into operation? And do you have any guidelines? In other words, can we access it within a couple months and become familiar with it?
So this is Jennifer Wadham with Xerox. It will be available for training prior to the 10/1 go live date. I don't have a specific date for you, but we will get to that to the state as part of our work plan for the development of the product.
Any, Mr. Mazzoni?
I want to do a little bit of rollback to the billing, and if in fact Xerox or Choice Administrators is a recipient of funds, they'll aggregate and send. What is the time frame for their distribution of those funds to the respective carriers? I guess I was understanding you to say also Medicaid, CHIP, wherever they're going.
That's correct. This is Jennifer Wadham again. Currently, we have that as a weekly process, a batch process to the carriers. They get their funds weekly. We can talk to the state about doing that differently, but that is what we proposed as a weekly process for those distributions.
You also may recall in our last meeting that there was some discussion about if someone's using a credit card and the fee accompanying that, and we were told by the Department of Insurance it could not be added on to anything. Has that been addressed by you, Xerox, or by the exchange staff?
For the record, John Hager, we discussed that earlier today, in fact, and I believe there is an attachment to item 7, I think, from the Division of Insurance. We can charge the individuals a credit card fee. However, if we do that, that charge to the individual would be considered premium, part of the premium, and taxable. So there'd be an administrative step that we'd have to make sure that we got that information to the carriers and they understood how to deal with it. It's difficult to say yet whether or not we'd want to pursue that. The other option is that the exchange allow credit cards to be charged and that the exchange absorb that cost. However, that could end up being quite costly and increase our per member per month fees. So there's pros and cons to both. If you charge the individual, and again, this is considering that this would be another situation where Xerox did the individual billing as opposed to the carriers, and that obviously we need to discuss that at the next agenda item, and these kind of run together. But if we charge an individual for the use of their credit card, it creates an incentive to not use the credit card, rather to use automatic funds transfer, EFT, what have you, the means that are fairly inexpensive and Xerox currently supports without any additional cost. If you charge a credit card fee, we have to be aware that, or if they use credit cards, if a consumer uses credit cards, there will have to be a way to be able to recoup those funds, whether it's through a fee to the consumer who uses it, or whether it is through it's absorbed in the operational cost of the exchange and charged to all consumers. And again, it affects the way the premiums are collected and the taxes, how the taxes are calculated. It also affects the MLR cap, and we can get to that a little bit more later. But it is certainly an issue that we have to consider. And I think Mr. McCoy has a question.
Yeah, that's just a quick question and a comment.
I think
I'm sorry.
No, that's okay. I think Mr. Mazzoni just wanted to finish up, had one more question, and then we can get to Mr. McCoy. Thank you. Thank you.
Hi, Tom. Dwight here. You talked about the capacity of the call center, and I'm not sure how this works from a legal perspective. The call center employees, would they be navigators? Would they be licensed insurance agents? What will they be, or are they just somebody we can go find off the street that can man a call station, a qualified person, not just anybody? What kind of puzzle are we getting ourselves into trying to make sure we're complying with Secretary Sebelius's letter and also all the rules that we're running into with PPAC and ACA? I'm concerned that we have a call center, but what's the qualification of someone working at the call center?
This is Jennifer Wadham from Xerox. We are discussing that with the state and whether or not call center representatives have to be certified as a navigator or an assister. So that is still being worked out and considered.
Point of clarification, Mr. Hager, did we not change the name of sisters to something else recently?
It's being proposed. So
Yes, and
I think they're using outreach specialists.
Rose by any other name, right?
Mr. McCoy, do you have a question?
Yeah, a question and a comment, I guess. A comment being is that typically I have family members that have been in the call center business at different times, and a daughter that's in the insurance business right now as a call center. Most of them are licensed and have to be licensed in a particular state and oftentimes multiple states. But my question beyond that, this is Nevada. 24-hour-day communities, especially in southern Nevada, to some extent Reno as well. I would think, and the state may not appreciate this comment, but I really think that we probably will need a 24-hour-a-day call center, as most insurance companies have for claims and so forth. And the reason I bring that up is I think that we have people that work crazy hours. They may try to get online and have a problem at 2 o'clock in the morning. And that gap, it's sort of like the question I had earlier about the timeline between verification and otherwise. I would hope that early on, and this of course gets into a cost factor, that we would have the call center staffed with shifts to the point where we can be responsive to the communities that we serve in Nevada. And when you say 25 to 30 people, is that per shift?
This is Jennifer Wadham from Xerox. Note, it's 25 to 35 people total, so for the day. It's not.
It ain't going to work.
So I'm just telling you, per our contract, that is based on the volume of people that are expected and our experience in call centers, that is our 8 to 5. I think the call center hours are a little bit different than that, but that is a one-day shift. It is not multiple shifts for 24/7.
Okay.
We do run 24/7 call centers. That was not part of our agreement.
Madam Chair, if I might.
And if I can just let Mr. McCoy know that your question and comments are getting a lot of head nodding by your fellow committee members here. So since you can't see that, I just wanted to share that with the group.
For the record, John Hager, I would like to assure the committee that there are very strict service level agreements and financial penalties should they not meet those service level agreements. I believe an abandonment rate of 3%. I believe there's so drop calls, time to answer, various requirements that they have to meet, and if they don't, they will have a financial penalty, which I'm sure they don't want to pay. But even worse than a financial penalty is going before the board saying I didn't make my service level agreements, and I can assure you, based on experience with previous boards, that anytime a vendor gets up there not meeting their service level agreements, it's not comfortable at all. While Ms. Wadham indicates that there will be approximately 30 people in the call center, I would expect it's going to be quite a bit more during open enrollment, especially at first, and I would hold them to those service level agreements. I hope that helps satisfy some of the concerns.
Mr. McCoy, did you have another question or a comment?
No, that pretty well cleared it up. Sort of.
Great, thank you. I know there's a couple more questions here. I want to see, Ms. Lewis, if you're still with us on the phone, did you have any questions or comments?
Well, I am still with you on the phone, and I did not fully hear because there is some difficulty in hearing the response as to the hours for the call center, because I had some of the same concerns that were expressed earlier. So can you just give me that again? The hours of the call center operation?
This is Jennifer Wadham with Xerox. It is not a 24/7 call center at this time. I need to check on the hours. It is a daytime call center, so I want to say it's 7 to 7, but I can verify that for the committee.
7 to 7. Okay. Thank you. But you think that that's the time frame?
Yes.
Thank you very much.
I will verify that.
Thank you.
We have a couple more questions down here. Ms. Ellis?
There's actually a couple of comments. I just want to make sure that we understand that the uninsured population, especially in Nevada, a lot of them could be on a cash basis population. So we're talking about credit cards, assuming that these people own credit cards, have bank accounts, and even have any credit at all. So we need to take that into consideration, and I did not hear any consideration on that on the demonstration. Also, as far as the call centers, in Las Vegas is very particular, Nevada at large is very particular because of our 24-hour status or lifestyles here. And I do understand that call centers are licensed throughout the nation as call centers, though, but and the staff primarily provide customer services functions. But what they will be doing, as I understand it, and please clarify if I am mistaken, for the Silver State Insurance Exchange is basically the role of the navigators, and because of that, I think that a great consideration should be made to license their staff or the company that manages or employs these individuals as navigators so that they can fully comply with what our regulations are going to be as we're setting them for everybody else, and also to make sure that they do help these individuals that are seeking insurance to the full extent of their assistance, because the worst case scenario we want is just some customer service rep to have answer the questions 25% of what they need and then tell them, I'm going to refer you to a navigator, which is not an unlikely option if that's what needs to be chosen. But I guess we need more explanation of what their role is going to be, what the extension of their job is going to be, and their extension of the relationship with the callers. Thank you.
For the record, John Hager. We're actually in discussion right now with the Division of Insurance to make sure that the call center representatives are appropriately certified or licensed. I can assure you that the Division of Insurance is very concerned about consumer protections, as am I, and we will make sure that those that are answering the phones on behalf of the exchange to enroll people in products have the training and certification that are required to do that job.
Thank you. I think we have no more questions down here. Anyone? Any other final questions? Mr. McCoy? Any other questions up north?
No, not at this point.
So with that, I think we will close agenda item 5, and I wanted to thank the people from Xerox to come and make this presentation. As I said, I thought it was quite enlightening and interesting, actually starting to see how this is going to look and how it's going to work. So we appreciate you hearing and answering our questions and listening to our comments. And with that, I will ask Mr. Hager to, one moment, Mr. Mazzoni.
Just for a point of clarification, and I don't know whether this is for you, John, or for the Xerox Choice Administrators people. When we say there's an open door for anybody, making sure they go to the right door, what if that door is Medicare, not Medicaid? Are they going to be referred out to an outside source? Are they going to be referred to SHIP? Are they going to we going to have an agent's name? We're going to send everybody to one agent? That's facetious, of course, but what's going to happen to the people that happen to be there and they really do qualify in one way, shape, or form for Medicare? Secondarily, what if they're a dual eligible Medicare, Medicaid? I think if we're not talking that with somebody, or if that's not on the agenda, we probably need to add that so we can give some direction as to where those people need to go or should go.
For the record, John Hager, so the question about dual eligibles, we need to work through that scenario with Xerox and with Medicaid. There are, in fact, quite a few different scenarios that we have to work through and track from start to finish. I don't know how many there are, but there are quite a few of them, and we are. I think we're aware of most of them, if not all of them, and we've got a team of bright minds that are working on it from Medicaid, welfare, Xerox, the exchange, Deloitte, are all brainstorming to come up with all the possible scenarios. And we've got people that have been working in those industries, whether it's insurance, Medicaid, welfare, for quite a while. So we will work through all the scenarios, including the dual eligible scenario. The issue for Medicare enrollees, Yes, so it's not quite one door for everybody. It's one door for just about everybody under age 65, unfortunately. If you are Medicare eligible, the Affordable Care Act does not provide for purchasing insurance through the exchange for Medicare individuals. We had a fairly extensive discussion at the Finance and Sustainability Committee about whether or not to refer individuals who are Medicare eligible to a Medicare coordinator service. That idea was dropped, as was an idea to contract with individual brokers that were Medicare brokers or producers that sold or helped people enroll in Medicare products. So what that committee came up with was providing a list of brokers who sell Medicare products or the SHIP or state programs that are available, or a combination of it. Probably would have the SHIP program listed first, and the various state programs, and then potentially a list of brokers after that specialize in Medicare products. We're still working on it, how that would work, but there was quite a bit of discussion about allowing a person to self-refer based on the people that are the resources that are available to that person in their local area.
Thank you. I think with that, we will move to agenda item 6. I am going to want to give everyone a break at some point, so I'm thinking maybe right after agenda item 6, unless anyone would like a break now. Are we okay to move forward? Okay. So with that, Mr. Hager, if you can walk us through agenda item 6, and also it is my understanding that we must give a recommendation today to the board, and Mr. Hager, if you can explain the timeline on that.
For the record, John Hager, yes, it would certainly be helpful. So the most critical component of this is actually determining how we move forward with the IT implementation. There's a couple of things that are waiting on this decision. First of all, the workflows all depend on the individual billing scenarios. If the carriers do individual billing, then there is a different process. Not only is the billing different, but also the who collects the money and how we get that money to the exchange and to Xerox. Whereas if Xerox does the billing, they collect the money and then get funds to the exchange and to the carriers. The other issue is that Medicaid and welfare run the eligibility for Medicaid, for Medicaid and CHIP. They currently have an outdated and antiquated CHIP billing system. Maybe I'm speaking too harshly about that, but my understanding is that they want to update the billing system for CHIP. Maybe I should say it that way. If the exchange were to do individual billing through Xerox, then the Xerox system would do the billing for CHIP, as you've seen in the previous demonstration. If we determine that the exchange will not do individual billing, then they will need to build that billing system, added cost to the state to build that system. All of these decisions are waiting on this one, and so we make a recommendation today to the board. The board will decide that hopefully on September 13th, and we can move on with the programming part of this. Remember that we need to go live by October 1st, 2013. So we're squishing a 2-year implementation into a 14-month period. By September, that'll be 13 months. Obviously, we're already starting work on it, so basically 14 months. But these decisions need to be made soon. And then additionally, you have to remember that we need to have the system available for training before October 1st. So all of these requirements compress the implementation timeline, which is why it's important to get this decision out. So with that, I will go to the 13-page report. I hope everybody had a chance to read it, because I'm going to try and go through it briefly. In the background, we talk about the how billing is typically done. The major issue that we point out is that currently carriers do billing. Some of them send in a paper bill, some of them do it electronically, or a combination of both. But when an individual gets a bill, they get it for their policy, and it might have their dependents on it. It may not. You saw the scenario where there's an individual with a spouse and 2 children. The children are on CHIP. In the case of that that family, they'd have to send in a bill or a payment to the carrier and a payment to CHIP. Additionally, if they had dental coverage, that would be separate. If they had vision coverage, that would be separate. So the opportunity is there to be able to aggregate these individual bills on a family basis and get the for Xerox to collect the funds and distribute it to the carriers, and then the carriers would receive one check for their entire population for any money that was received by Xerox over that week. Or if we compress it to one day, then any check that was received by Xerox for that day, they get a single check with a single file that has all of the payments that were made by the individuals. So keep in mind, this is about individuals, not about the small employers. On the shop side, the Affordable Care Act requires that premium aggregation occur, and so this will already happen on the small business side. The flexibility is given to the states to determine how it will be done on the individual side, which is what we're discussing here in this document. On page 3, we see the discussion, the table of the advantages to the exchange, carrier, and the individual. And that goes down to page 5. This table was provided as the last slide of Xerox's presentation. This is what Xerox estimates to be the savings to the carrier, so the question that we've had for Xerox is this 3.725% of premium, is it of the administrative expenses? They've indicated that it's of total premium. So if you have an average premium of $300, that would be about $9. I don't know if that's really the case because I haven't seen their data. They indicate this data is based off of 15 years of experience with their exchanges at Choice Administrators in California. However, if we look at it on a smaller basis, let's pretend that with the MLR cap, you're only looking at the 20% of administrative costs. So 20% of $300 is $60. 3% of 60, you're looking at about $1.50, $1.80, somewhere in there, maybe $2. So that is so you have a $2 savings. Or if you're only looking at half of that, because the other half of the administration is marketing and advertising, perhaps brokerage fees, whatever other items that there might be, then perhaps you save only $1 or 50 cents. And we'll get to the cost to the system later on. So regardless of, again, it's difficult to say what that truly is, what the multiplier really is. Again, according to Xerox, it's the whole amount. Not to say that they're incorrect, but even with those lower amounts, there is a cost savings of some kind, and so we have to kind of weigh that to the costs that this would be for us. So again, support for the exchange billing model on page 5, aggregated bills for families, the ability to track payments and life events with the exchange over multiple carriers. So if a person changes from one carrier to the next, the history of the payments would be in the system going back as far as they keep it. They indicate that there'll be improved customer service and member retention by simplifying an individual's ability to view their bill and pay online or via a single dedicated call center for all enrollment and eligibility questions. That individual billing process allows members to establish reoccurring monthly payments. The ability to have the exchange process payments on behalf of members will also allow for more streamlined and accurate reporting to the appropriate agencies as required by the Affordable Care Act and associated regulations. So the reporting function currently, much of the reporting currently falls on the exchange, and so this would obviously let me back up. The exchange is a system of record for eligibility for the advanced premium tax credit. All that reporting is required to go to the federal government, and so this allows us to push it rather than pull the data from the carrier for billing. The Xerox team has indicated that they have multiple ways to collect payment: interactive voice response, capture, check by phone, paper checks. They have collections methods, and I'm going through this fairly quickly, but they can pay by mail through the call center or via the web portal. Other considerations: if the insurer performs qualified health plan billing, the incumbent insurer health plan will likely do the renewal during the billing process. This may discourage a new comparative shopping process at subsequent open enrollments, as consumers will inevitably buy the renewal versus a new comparative shop and compare evaluation in the updated market. It will also make the consumer less aware of new products offered by the exchange. From the carrier's perspective, they feel that they should be rewarded with the by allowing them to do the billing and renew. That would allow them to keep it would make it easier for them to retain their consumers. So from their perspective, they would prefer obviously not to do the individual billing, and we'll talk about their opposing view later on. Consumers experience life changes during the policy year, including births, deaths, moves, marriages, divorces, etc. As family composition changes, plans with a good rate for one family composition may not be ideal for a different family composition. So if an individual moves, a carrier that had an ideal qualified health plan for one service area may not be ideal qualified health plan for another service area. Consumer billing complaints and issues will likely be directed to the billing entity. The exchange would lose a level of health plan oversight and management and may expose consumers to an inconsistent level of exchange service and experience on a plan-by-plan basis. And again, one of the carrier's responses was that this is one of the things that distinguishes them from their competition, that they would like to be they would like to do that so that their customer service, they can be distinguished by their customer service. Xerox provided a long segment on managing late and delinquent payments. I'm not going to go into all that, but to say that the setup is there. We are very confident that Xerox will be able to manage the late and delinquent payments. They can also do premium adjustments for prior months due to updated eligibility information, and they'd be provided on the next month's invoice. Financial reporting, there's a whole list on page 10 of the examples of reports that are available for financial reporting. And then on page 11 we get into the financial impact to the exchange, and this is of course is a key part of this document. So the table on page 11 shows the difference in cost to the exchange if the exchange were to perform individual billing through its contract with Xerox compared to if the individual carriers performed individual billing. The current contract maximum is $72 million, and actually that's no longer pending BOE approval. It has been approved. If the exchange were to opt out of the individual billing, the estimated cost of the contract would be approximately $5.2 million less, or approximately $66.8 million. Now, those numbers are based on the enrollment that we have estimated in conjunction with the Department of Health and Human Services, and you see those numbers: 145,000 the first year, 183,000 the second year, and 206,000 the third year. And so the difference in cost is $1.25 for 2014, which will be entirely paid for by the Affordable Care Act grant funding. If you were to view our finance and sustainability plan, you'll notice that the difference in cost and fees to the carriers is about 20 cents. And the reason for that 20 cents is we wanted to start with a 60-day operating reserve. And to do that, because our operating costs would be higher under individual billing, then the 60-day operating reserve would have to be slightly higher, so the amount that we'd have to collect would be slightly higher to hit that 60 days. But that's only the amounts that go into the operating reserve, and then we gradually draw that operating reserve down to a 30-day level over the long term, so the fees are reduced in subsequent years by the amount that needs to be drawn down in that operating reserve to hit the long-term rate of a 30-day operating reserve. We do the 60-day reserve because of the unknown in enrollment. We're trying to hedge our bets, if you will, to make sure that we don't end in a negative cash situation. So responses from carriers. The opposing view is that it's a duplication of services, that carving out the premiums processing to a vendor only for exchange business adds duplication and costs to the overall health care system. Carriers would still have to perform premium processing for all non-exchange business, so economics of scale would be lost. Renewals, the incumbent plan who has taken on the risk all year should be allowed to do the renewal billing. Anything but this would have a negative impact to the carrier. Potential renewal coverage lags collections and cash flow. The carrier has worked all year to develop and enhance the relationship with the consumer, and the carrier should not be penalized for their year-long efforts. The carrier, and it says our because this was copied from one of their documents. The carrier should not be allowed. The carrier should not only be allowed but also strongly encouraged to be in direct contact with the consumer with every life cycle change or billing issue. Relationship touch points should not be outsourced. Pay as billed is unacceptable to payers. The vendor's proposed solution of telling employers to pay as billed is not a consumer-friendly model. Carriers have desired this for years for operational and cash flow reasons, but unless it is mandated, no employer wants to pay for retroactive termination or changes. Employers want to adjust their bills as needed, have their invoices recalculated, and pay only for those members who should be covered. For example, not as the vendor proposes with any corrections adjustments for prior months due to updated eligibility information provided on the next month's invoice. Cash flow. Currently, carriers can post cash the moment the payment is received. This proposal has the potential to decrease the carrier's cash flow by increasing the float as the vendor consolidates the payments, considered suspended premiums as described, and eventually sends the payment to each carrier. It penalizes established and committed carriers. This model would potentially penalize established carriers who have worked for years to develop relationships with consumers and significant capital to develop consumer-friendly billing and collection systems. And finally, local payments. As a local carrier with all of our premium processing employees employed in Nevada, we currently accept a large number of cash payments at our local office, which is very popular with consumers and cost efficient. The vendor proposal does not allow for local or cash payments, and for that I would say that we are working on the cash payment issue. And before I go on to the supporting view from one of the carriers, I lost my train of thought, so I'll go on to the supporting view. Premium collection and related administrative functions should be centralized in the exchange as much as possible. By concentrating these functions within the exchange, a streamlined, well-coordinated process can achieve efficiencies similar to those leveraged by large employers in the employer-sponsored insurance market. These efficiencies would translate to reduced state costs and ensure uniform billing. Regarding federal statutory language permitting individuals to pay premiums directly to insurers, Xerox recommends the state consider strongly encouraging direct payment to or through the exchange as a default approach. So this one is slightly miswritten, I guess. I'm not sure if that's a word. The carrier is indicating that Xerox should recommend or strongly recommend to individuals that they pay through the exchange. Actually, this is what I was trying to. Okay, so I guess this is an edit error, but in any event, so the issue that I was trying to bring up earlier, under the regulations, while we can require that we do individual billing and do most of the individual billing, we also have to allow an individual to pay the carrier directly. So on a one-off basis, a consumer could pay the carrier directly. So for the cases of cash payments, they could pay directly to the insurer if they'd like. And again, we're going to work on how we collect cash on our end. But it's required that we allow an individual to pay the carrier directly. That said, we can strongly encourage that they pay through the exchange and work through the electronic processes. And on the third bullet, there's an additional error. But if a centralized mechanism for these functions is not feasible due to carrier opposition, the carrier would recommend the state develop clear and consistent standards for the health plans or vendors that will perform these functions to at least mitigate the potential for enrollee abrasion arising out of inconsistent practices and capabilities. So with that, a lot of information, I realize, 13 pages and not a whole lot of time. But with that, the staff's recommendation is to provide a recommendation to the board regarding whether the exchange should conduct individual premium billing through Xerox Healthcare LLC.
Thank you, Mr. Hager. We have questions. We have lots of questions. Ms. Parati-Boothman.
Thank you, Madam Chairman. Gina Parati-Boothman for the record. I have one question. I believe you may have clarified that on page 12 of this document under the response from carriers, local payments. It does say the vendor proposal does not allow local or cash payments. So is that what you were just referring to, Mr. Hager?
Yes, we're working on local payments and how that would work.
Because the cash piece, again, for certain populations, I think to be able to pay is important. Ms. Ellis also had what I thought was a very reflective statement as we were discussing this. If there is not the ability for cash payments, will it create the need for people or navigators to sell Visa gift cards? I mean, you know, it's a potential option if these individuals can pay cash for the gift card and then it's a Visa gift card and, you know, you settle that.
Lynn Atkins, not loving the Visa gift card idea. There's always fees associated with those things. However, so am I to understand there must be an option for consumers to pay the insurance company directly by cash, and we are looking into having Xerox accept an aggregated payment of cash for everything?
You are correct that we are required to allow the individual to pay the carrier directly, whether that's by cash, credit card, however the carrier accepts payment. The second part of that statement was close. We will not accept, we would accept a single payment per family. That's the idea of the individual billing, is that we would accept one single aggregated payment by family. We would collect all of the payments from all of the different families that are paying and aggregate those and give that entire lump sum to each of the carriers based on the payments that we receive for those carriers. So it's basically a redistribution channel that allows the carriers to receive one check or funds probably a funds transfer with a single file that says, you know, this $100,000 of premium payments is made up of, you know, Joe Smith, Sally Ride, all these other, you know, various people. So I think that answers your question.
I guess I'm not sure. I don't think I was clear. Maybe I was. So if somebody goes on the website, purchases insurance for a family of 4, and they want to pay for all family members, but in cash, will there be a place for them to do that?
So again, they will obviously be able to pay cash directly to the carrier, and we are working on a way to pay cash directly to Xerox. There are various methods to collect cash, whether it is a local office, whether it's a kiosk. I understand DMV collects cash and does credit card payments, and so we have a line item in our budget to do kiosks. So we're working on how we would collect cash, but I do think it's important that we have the ability to collect cash locally.
Thank you. Other questions? Mr. Mazzoni?
Dwight Mazzoni for the record. Everybody, you keep mentioning in here, Mr. Hager, credit cards. Is there a difference in cost or availability to the consuming public of, which I know the answer is yes, of credit cards versus debit cards? There's also an added deal segueing off of Ms. Ellis's comment. You can go just about any place and buy either a money order or buy a Visa card that's reloadable, that you don't have to qualify for on a credit basis. So do we have any data that has been collected or is available to us about credit cards versus debit cards versus loadable cash cards versus the availability of money orders, particularly for the rural locations? And would you put a kiosk in Ely or Austin? I don't know. Question, not rhetorical question, not an answerable one.
a lot of questions in there, and some of them are answerable, and some I'm not sure yet. But obviously, there are differences in cost between cash money orders, credit cards, debit cards. I don't know off the top of my head all the differences in those costs. My understanding is that CHIP does not accept cash, but that they do accept money orders. So that is something to consider. Of course, if what CHIP collects is not necessarily what we need to collect, because we would be collecting the funds and then doing electronic transfer of funds to CHIP. So that might be slightly off topic. So one of the issues that I brought up briefly before was about the credit card transaction fees and how that would work. And again, if we were to charge a fee to consumers for credit cards, that is my understanding from the Division of Insurance is that, and they can come to the table if I get this wrong, but that if we charge a fee to an individual for using their credit card, that needs to be included in the premium for the premium tax calculation, and therefore we would have to, if we were to do that, we would have to transfer that information to the carrier so it would be included in the premium tax calculation. If we simply absorb the cost of taking the credit card in the operational expenses of the exchange, that would not be a taxable event, assuming that it would not be a premium tax. It would not be part of the premium tax calculation, assuming our bill draft request is approved by the legislature to exempt the exchange fees from the premium tax calculation. Am I good? Okay, they're nodding their head yes. So far so good. Obviously, there are differences in cost. Xerox has currently accepts automatic transfers, EFT, and Ms. Wadham's at the table if she could provide what else they accept that would be in the current contract.
So Jennifer Wadham from Xerox for the record. We currently accept checks, pay by check through the IVR, credit cards, EFT transfers, and automatic fund transfers on a monthly basis. So all of those would be available. In addition, although we don't recommend it, individuals can send cash, and we will process that cash through our check processing department.
Lynn Adkins, I just have a question about that. But the only thing with an add-on fee is the credit card processing. Everything else that you mentioned does not incur an additional fee. Is that right?
There's nothing else that incurs an additional fee from the exchange or from Xerox. We have no control over what the bank charges for that person to use automatic funds transfer or EFT.
Mr. Mazzoni?
To continue on, Mr. Hager, you mentioned in the report it talks about sending the funds that we collect or that the exchange collects to CHIP. Is there a billing fee to from? Does CHIP pay us a fee for collecting funds for them? I already probably know that answer, but I'll ask it anyhow. We talk about all these other organizations. What about CHIP or any of the other state organizations? If we're remitting premium to them in some way, shape, or form, or is there any, I don't know, tit for tat for fees or anything like that, or does that even exist? I don't know.
For the record, John Hager, in fact, it does. It is not based currently on it's sort of based on a per member allocation. When we submitted our contract to CMS for approval, we also had to have a cost allocation methodology to charge CHIP and Medicaid. Under that cost allocation, the current allocation is approximately 5% of costs will go to CHIP and Medicaid, and that's for the enrollment function and for the billing. And so, if there is an increase to our cost due to Xerox taking on the individual billing, there would also be an increase in the cost allocation amount going to CHIP and Medicaid. That cost allocation methodology will be updated as we move along and get better enrollment data. But for now, yes, in fact, CHIP and Medicaid do pay a portion of this because they use the system.
Thank you, sir. Continuing on, relative to the carriers, and maybe I'm reading between the lines here a little bit, but there's more than one or two carriers, and you reference one local carrier. I could only think of one local carrier that meets this criteria, so we'll just leave that go as it may. But what have been their comments or their agreement to involve, not involve, or whatever? What's their buy-in, if you will, to what this 13-page document sets out?
So the comments that we received from the carriers, the supporting view was from one carrier. The opposing view was supported by several carriers, and we actually got comments from about 3 or 4 of them that were basically the same comments. So my understanding is a majority of the carriers, from the carriers that we heard from, a majority of them are opposed to it. We did not hear from every carrier. I don't know if the carriers that we didn't hear from are opposed or supportive or simply just neutral on the subject. But the opposing viewpoint is the opposing viewpoint of 3 or 4, maybe 5 carriers. I can't recall exactly how many there were that provided input that was along the same lines as this.
Thank you. What is was there any documentation or any research done on the cost or potential cost or loss to the carriers if we the exchange, I'm going to paint this very broad brushstroke here, but if we the exchange take away their ability to collect funds direct, we know that there's this thing called float and everything else involved with those funds that are sitting there with the carrier. Was that addressed in any way, shape, or form in any of the research done, or will it be addressed?
So the float is the 5 days it takes, or the weekly remittance of payment to the carriers. So if that is done on a weekly basis, 7 days, then the average float for all the payments is about 3.5 days, considering the payment that's done a week prior and the payment that's done the day before. So again, the average float is about 3.5 days. If we adjust this so that they remit payment to the carriers on a daily basis, obviously that cuts the float quite significantly. So basically, you're talking about Xerox collecting the payments and remitting them to the carriers, and I believe it's a fairly fast turnaround. I mean, is it maybe Ms. Wadham can comment on the turnaround.
So currently, this is Jennifer Wadham from Xerox. Currently, it is a weekly file that we upload to the carriers and remit to the carriers. As far as going to a daily, it would be a very quick turnaround. It's approximately 24 hours from the time we receive it to the time the carriers receive it.
I have one final one back at the top of page 12. The pay as billed is unacceptable to payers. To me, you're talking about group health insurance plans here, not individual plans. I wonder where it fits within this 13-page document, even though you had some commentary about it, sir.
My understanding is that that goes toward the group billing. Same understanding as you have. It was a comment that was provided by the carriers. I didn't want to leave out any piece of the carriers' comments.
And overall, has there been a cost analysis, further cost analysis following this research of the exchange doing the billing? And am I correct in assuming when I say exchange at this point in time, I'm saying Xerox/exchange?
Yes, we are partners.
Versus we leave it with the carriers. Has there been any cost analysis of that for anybody involved?
So yes, Xerox's success is our success. So when you say the exchange or Xerox, at this point it can be interchangeable. I will not be standing up a staff to collect premiums. That will be done through Xerox. The cost analysis that has been done is the extent of the cost analysis. The carriers have indicated that that this would actually cost them money. We haven't seen any information from the carriers specifically. The 3.75% that Xerox indicates would be saved was based on the last 15 years of operations for their current exchanges with Choice administrators. Again, I will admit I'm a little skeptical that it's of the entire premium, but regardless, even if it's of 1/12 of the premium, the savings outweighs the cost in the future years. Additionally, there has been public comment about an individual that has to send a bill to a health insurance carrier, a dental carrier, and a vision carrier, and cost of postage or running around town to pay those bills, and whether that outweighs the cost here. But this is the extent of the information that we have on the cost analysis.
Do any other committee members at this time have questions?
Yes.
Mr. McCoy,
yes,
any questions? Okay.
Yes, thank you. In talking about fees, what comes to mind is the healthcare ratio, the factor that we're always talking about in terms of what the carriers have to do in terms of providing medical care versus their costs. So I think that the administrative aspect of this is probably an important consideration, both for the exchange and also for carriers. But I'm curious, who's the payee entity?
Who's the payee?
Payee. I pay a premium. Who am I paying?
You are paying to the Silver State Exchange.
Okay, so Silver State Health Insurance Exchange
Correct.
is the payee.
Correct. We set up a bank account and are the facilitator of that bank account for the Silver State.
Yeah, there's some legal
Exchange.
considerations. The reason I'm
Correct.
asking
Yes.
this.
Yeah, and so we do not. We are not the payee for that. Xerox is not the payee for that payment. It is the Silver State. Health
Okay,
Insurance
so
Exchange.
who sends me that my premium's overdue? Silver State Health Insurance Exchange?
Xerox sends it on behalf of the Silver
On
State.
behalf of. So
Correct.
consistently, I'm dealing with Silver State Health Insurance
That is
Exchange, who serves almost as an agent for a bunch of insurance carriers.
Yes, that's how it could be viewed. Yes.
Okay. Thank you.
Lynn Atkins, I have a question on page 11, the financial impact to the exchange. So if I heard correctly as well, people will have the option of doing the premium billing, aggregating their billing. Is that right?
Yes.
Maybe I could. Okay.
Yeah. So yeah, they will have the option to. We will encourage them if we do individual billing. We will encourage them to pay the exchange, and we will distribute the funds. They have the option to pay the carriers directly. So if 25% of them choose to pay the carrier directly, does that change all of our numbers here in the grid, or is it not going to matter at the end of the day how many people do it because there's just a setup cost from Xerox? I'm trying to figure out how that works. The way the contract is written, we either do individual billing or we don't, and so the prices that you see here are regardless of how many people don't pay the exchange directly.
Mr. Mazzoni?
Help me out here just a minute, John. Dwight Mazzoni for the record, excuse me. I sit down, I go on to the website, and just to make it easy, I qualify for just the federal rebate on my premium. And 2 years ago, I bought an individual Delta dental plan that I have, and I have a vision plan that I picked up from someplace, and I pay for that out of my, however I pay for it. Am I understanding you correct that Xerox can consolidate all three of those no matter where the product came from, or are all three products that I have to be a exchange-based product, somehow fit into the QHP or whatever, and that the carriers have to agree to work through the exchange?
So Xerox will aggregate the premiums for any product that is sold through the exchange. if they're not sold through the exchange, we don't have an agreement. The part of the requirements for the qualified health plans will be you have to be certified as a qualified health plan, and part of that will be to agree to go through the exchange, and that premium aggregation comes out of that certification process and that agreement. Perhaps should point out that a majority of our population that we expect to enroll are currently uninsured, and so therefore if they don't have health insurance now, it's probably unlikely that they have dental and vision insurance. So for a majority of our population, it will probably be through the exchange. But you are correct that there will be a segment of the population that is currently insured that may have products outside the exchange. We can't aggregate those premiums for those products. We simply don't know what they are.
And hopefully one of the marketing tools of the exchange would be to encourage those who have insurance outside the exchange to come through the exchange so they could get aggregated billing and they could just pay once. I mean, that could be a potential selling point for some folks, assuming those products are available in the exchange.
Dwight Mazzoni for the record. If I could, I just want to understand what you're saying. So I have a product through Nightlife of Texas that is both in and out of the exchange. But I already have that product. I bought it from somebody else, not from the exchange. If I'm Nightlife of Texas, I'm not sure how I would handle moving that product from the individual billing that I have set up over here to pushing it over into the exchange, and then me reapplying or doing something that would make it now an exchange product. That would seem to me to be just a bit of a problem from the carrier perspective, much less from the exchange, and I'm not sure I would try and explain that to any insured. I think that would be very difficult for them to figure out. They have to cancel this one, reapply for this one, and all the other stuff, and let's forego all the federal involvement or anything else for a rebate.
For the record, John Hager. So yes, that would certainly be difficult to cancel and restart the policy from the carrier side. It's incumbent on the individual to shop for their insurance, and if they decide that they want a supplementary product or even a medical health plan on the exchange, they'd have to cancel that equivalent product that they purchased outside the exchange. From the medical side, to be eligible for the advanced premium tax credit, you have to go through the exchange to get that advanced premium tax credit. So they will have to disenroll on the one side and re-enroll. The individual would have to re-enroll on this side and do the shop and compare on their own. For the supplementary products such as dental and vision, to be eligible for premium aggregation, they'd have to disenroll on the product on the outside and re-enroll on the inside. Now, a carrier may choose to issue a letter to its consumers saying the plan that you're on is going to be available on the exchange, and we encourage you to go to the exchange to get that product. That would do a couple of things. Number one, it would help us get the enrollment and do the premium aggregation, and number two, it would help the carrier retain their business. So I think that really, if the exchange were to do individual billing, the only thing the carriers could really do at that point is to send their marketing material to the individuals to let them know that your products are now on the exchange, or we have this other product that's on the exchange that you could go to.
We have one more question, and then I think what I'd like to do is open it up to public comment before we entertain a motion. Ms. Ellis?
I have a question. What happens if I have insurance through my employer and I just want to shop the exchange to see if that would be more cost effective for my family? Can I go in, register, do all the data entry, demographic entry, do all the selection, and then just put that profile like on some kind of a parking space or on hold without purchasing while I price shop around and compare?
This is Jennifer Wadham from Xerox for the record. You can do browse plans, so I think what we showed in the demonstration is you can go in and actually build your family browse plans and research what it would be through the exchange versus your employer, yes, that way. And you can create an account and actually start the enrollment process to see that comparison and then save it under your account ID without actually going through the enrollment.
Going back to Mr. Mazzoni's case, I can see how a lot of people may just want to have a mixed bag of insurance products using the exchange and their current policies. So we should probably consider those scenarios. I can see employers' plan not being as strong for some employees currently, and they may just want to go into the exchange and keep some pieces of what they currently have and then get some stuff from the exchange, so that this could be getting complicated now. So,
for the record, John Hager.
At this time, go ahead, John.
If I might address that. So, in order to be eligible for the advanced premium tax credit, you cannot be eligible for employer-based coverage that is affordable minimum essential coverage. And so it adds a level of complexity to it. But if your premium that you pay, the employee's portion, is greater than 9.5% of your income, then that insurance is deemed unaffordable, and you can get the advanced premium tax credit. For those that are whose coverage is less than 9.5% of their annual income, and is minimum essential coverage, which is a bronze plan or better, they would not be eligible for the advanced premium tax credit. We will step through or attempt to step, we'll step through those questions in the system at the appropriate place. I don't think that the system currently has those, but we will build those questions in there, and it certainly adds a level of complexity because and it's largely based on an employee's word, and then a letter would go out to their employer. I'd rather not get into that part right now. It is certainly more complex, and it's a requirement of the Affordable Care Act, so there's not a whole lot we can do about it other than implement it as simply as possible. But while an employee could shop around, there are some parameters around that may make them ineligible for that coverage.
Thank you, John. At this time, I'd like to open it up to public comment. Anybody, please step forward. I do not see anybody in Las Vegas for public comment. Any public comment in Carson City?
We have one.
Does not. Okay. And we look like we have one person in Las Vegas as well. Carson, please state your name and your organization you're representing for the record.
Hi, my name is Michelle Decker, and I'm representing NAHU, also known as the National Association of Health Underwriters. I just had a question on the presentation for the children. I noticed that when the child was selected that there was only the CHIP offered for that child, and wondering why the other carriers were not available for them to choose. Because in the state of Nevada, all the carriers, when this was rolled out, they no longer allowed child-only policies. So the child would need to be added for the parent in order to pay for them and not have the child go outside. So I was just wondering why that option wasn't available. If that makes sense.
John, if someone could answer, I'm assuming that was because the income that was input in that example.
This is Jennifer Wadham from Xerox. For the record, yes, it was because of the income that makes the child eligible for CHIP. We can work with the state on the policies around that and what else they would be open for them from the health plans, but it was because of the income on the demonstration.
Yeah, that makes sense. Because I was just wondering, like I said, will we have the option of a carrier if they didn't want them to go into CHIP?
We would have to work with the state on their policies, but yes, we can make that available if the state so deems.
Yeah, like I said, there's no child-only policies in Nevada when this rolled out, so all the carriers decided not to, so that was just a concern. Thanks. That's all I have.
Thank you for your question. Las Vegas?
Hi, my name is Larry Hurst, representing the Nevada Association of Health Plans, and Madam Chair, thank you very much for the opportunity to speak to you and your esteemed board. I represent all the major health plans in Nevada. We represent 41% of the insured population. We're always trying to do the right thing for our consumers, our purchasers, and employers, for that matter. And I'd like to placed this cup of the styrofoam cups right in front of us. This is what's on the table. The fact is the Affordable Care Act states that health plans can and should bill the individual for their premiums. So keeping this right in the middle of the conversation, everything else we talk about goes around the side or under it or over it. So my point is, because of that fact, we think it'd be a little bit easier if we handled that billing going forward for a couple of reasons. One is the IRS is going to handle the reconciliation and the distribution of subsidies directly to the carrier. So it's not going to go to the exchange for reconciliation. It goes directly to the carrier. So it would be a lot simpler and it would decrease duplicative services and administrative costs if it was just handled with each carrier. Secondly, Adam Plain gave you guys a letter regarding there's some statutory issues which should not be looked at or set aside. Maybe there need to be some statutory changes at the next session, but for that matter, I think it really should be looked at because Adam's comments are very important. And then last, there is some precedence in California where there was a recommendation to have the carriers perform the individual premium billing. So there is precedence. And the issue around that was dishonored payments. There could be some legal issues if payment of premiums lapse of coverage, and there was some sort of an issue with a third-party administrator besides the carrier handling that. Lapse of coverage, there could be some legal issues with ramifications of errors and omission, things of that sort. So for those reasons, and I think those are pretty important, individual billing should be handled with the carriers, and I'm available for any questions.
Thank you very much. Any other public comment from up north? Is there a motion?
We have the Division of Insurance would like to speak.
Thank you. And I also forgot, is there any public comment on the telephone? Okay. Okay, go ahead, please.
Madam Chairwoman, members of the committee, thank you very much. For the record, my name is Adam Plain with the Nevada Division of Insurance. I did submit a letter to the exchange with a couple technical concerns regarding the premium aggregation. You know, the division's not taking a stand either way, but because the carriers have experience, we've kind of worked through these issues, whereas with Xerox it's a new process, and so we just want to bring those issues to light that they need to be discussed, they need to be thought through, and eventually they'll need to be worked out. In regards to the non-payment of premium, it is an issue that we've discussed and looked at. We had a discussion with Mr. Hager this morning. In the Affordable Care Act, the non-payment of premium cancellation provision for the state of Nevada has been overridden at the federal level as long as the insured is receiving an advanced premium tax credit. So now a policy for such an individual cannot be canceled for non-payment of premium unless 90 days have passed since their prior premium payment. But once that termination is eligible, the carrier is allowed to terminate retroactive to the last premium payment date. So in the case of Xerox collecting the premiums, doing the aggregation and remittance, there's a fairly large window for that issue to get worked out before it becomes a financial problem for the carriers. But then the retroactive termination kind of solves that problem to a certain degree. But I will say that if someone is purchasing insurance on the exchange and is not eligible for the advanced premium tax credit, then they're not afforded that 90-day window by federal statute. They default back to Nevada's statutory 30-day window, and I don't believe there is a retroactivity clause in Nevada statute. So that is just a little technical piece that would have to be ironed out as well. Thank you.
Thank you very much for that information. And with that, do we have a motion from the committee? I think Amber's ready. I think Ms. Joyner's ready to make a motion. Well, I think we need to. Yeah, well, if we can have a motion, and then if we have Ms. Joyner's ready to make a motion, or
okay.
Ms. Lewis, did you have a comment?
No, I was going to make a motion.
That's fine. Go ahead, Ms. Lewis, and then we'll have discussion.
Well, I thought you said
Once
Ms.
it's
Joyner
seconded.
was going to make a motion.
She's allowing you to make it.
No. Okay. Well, I move that we recommend that the exchange to the premium processing, that premium processing goes through the Xerox organization that we have secured for doing the overall processing, for the exchange. I don't know whether that's a good motion or not, but that's my motion.
No, that's fine. Is there a second?
I'll second that.
Ms. Joyner has seconded. Is there, and now for some discussion. Ms. Ellis? No?
I just want to make sure that with this motion, we take into consideration that the cash payment is considered, because so far in this document, it has been excluded. It is excluded according to vendor proposal does not allow for cash. So I just want to make sure that this motion is made contingent that the cash issue is resolved in the contract.
Mr. Downey?
Levon Lewis, Madam Chair, I would certainly agree with that, recognizing that many of the people that I deal with in my organization who would have little opportunity to pay other than with cash. So I agree that the cash payment must be considered as part of this motion.
Mr. Downey?
Randall Downey for the record. Ms. Ellis, would you consider that a friendly amendment to Ms. Lewis's motion?
T.B. Ellis for the record, yes.
Ms. Lewis, would you accept that as a friendly amendment to your motion?
I most certainly would.
And I'd second to the motion.
The person who seconded the motion needs to accept the amended motion.
I do, thanks.
Okay, so the motion on the table is to recommend to the board that the exchange allows Xerox to do the aggregated premium billing with the understanding that the committee wants to allow for cash payment as well. Any further discussion? Mr. Downey?
Thank you. Randall Downey for the record. I want to speak in support of the motion. I thank Ms. Lewis and Ms. Ellis for the amendment as well. I think that's a crucial element to allow cash payments, and that process must be instituted. I think this amendment is important for two reasons, if for two reasons only. The first is we need to help protect consumers, and I think an aggregate bill, a simplified billing system, is more consumer friendly. This process will speak to that. And I think it also helps notify the consumer, and this will be a long-term situation, and it prevents passive rollover. Plans change, and I think we will find over time that plans change on a yearly basis, and it's important to allow and by doing the aggregate billing, I think we allow the consumer to step back and recognize they need to take a look at their coverage and possibly make a change in a future year. It stops the passive rollover effect if the billing is done as currently through the carrier alone. So I support this motion.
Any other discussion?
Tom McCoy in Carson City. Just to follow up with that, I think many of us who have health insurance and have dental, have vision, we're aggregated. Okay, we're used to what we're talking about here, And when you take into account the uninsured in Nevada, or for that matter any state, but I'll focus on our state, we're dealing with people who have not had any experience dealing with health insurance, let alone perhaps anything beyond a car insurance. And so this opportunity for them to get basically a bill, whether it's paperless or something that comes in the mail, that tells them exactly what they owe, the bottom line, I think we will avoid the potential of some of the things Mr. Plain talked about, and that is some of the termination problems because, oh, I forgot to pay my dental, we need to assist these folks early on. And so I think this is a step in the right direction to make our health exchange more accessible and more manageable for the people we're trying to serve.
Thank you very much. Mr. Mazzoni has a comment.
Actually, if I might, Dwight Mazzoni for the record. Adam, you mentioned that we have the 90-day window and retro on an earned income tax credit. Is the funding from the federal government through the exchange back to, actually in this case to the carrier, that on behalf of an insured, is that considered an earned income tax credit or is it something else? Do we know?
For the record, Adam Plain, Nevada Division of Insurance. Mr. Mazzoni, if I understand your question correctly, the advanced premium tax credit is a structural tax credit on the individual's income tax return. In original theory, it was only available to the individual when they filed their year-end 1040, but the federal government allowed it to be distributed directly to the carrier on an advanced basis, with the caveat that it be used to purchase a qualified health plan. So in the case where an individual has coverage and is receiving the advanced premium tax credit and doesn't pay their premiums, the federal government will continue to pay that premium tax credit money to the carrier until such time as the carrier non-renews the policy or cancels the policy for non-payment of premium. When the policy is canceled for non-payment of premium, since it's retroactive back to the last payment date or last date that the payment covered, the carrier now has a liability for that advanced premium tax credit money that they were paid in the preceding, assuming 90 days. That now has become revenue received but not earned. And then it becomes a matter between the carrier and the IRS as to whether it needs to be paid back, whether it can be retained and bled off against other liabilities, or how they're going to account for that. Did that answer your question?
I think you did. Let me try and clarify it. So whether I'm filing a tax return and I get it on my tax return, or I'm buying a policy through the exchange and that credit is applied through the exchange, if you will, and given to the carrier, it's the same IRS code or whatever code we're using to pay that money. So it doesn't matter where it comes from, it will trigger that 90-day look back. Is that right?
Thank you for the clarification. I believe under the current regulation that is correct. The way it's written in the preamble to the Federal Register is that the 90-day grace period is available to those folks receiving an advanced premium tax credit, and it doesn't contemplate whether that, or more precisely a premium tax credit, and it doesn't contemplate whether that's on an advanced basis or an at the end of the year basis, and it also doesn't contemplate, whether it's direct billed by the carrier, aggregated through the exchange, or paid in some other fashion. It's just a factor of that the person is eligible for and receives the premium tax credit.
I think that pretty well clarifies it. Now, to take it a step further, what type of what problems now could be created in the exchange handling the billing versus, and I'm understanding the positives that some of my fellow board members here have talked about, but with the exchange handling it, and maybe we need to get input from the carrier rep, versus it being handled directly by the carrier. Do we have any input on that, either from Mr. Hager or from someone from the carrier side? Adam gets to get away.
For the record, John Hager. My understanding, and Mr. Hurst can correct me if I'm wrong. My understanding is that if a person is terminated for non-payment, the reconciliation with the IRS for receipt of that advanced premium tax credit is the same, regardless of whether we do the billing or the carrier does the billing. I think the only point of concern could be that if a person sends their payment in on the 90th day, and Xerox turns that around within 24 hours, whether or not the carrier retroactively terminates them back 90 days because they didn't receive it. And so we'll have to work with the Division of Insurance and the carriers. If we do the individual billing, we will have to work with the carriers and the Division of Insurance to make sure that we have proper policies in place to make sure that that retroactive activity occurs on a consistent basis. But the reconciliation for the advanced premium tax credit should be the same regardless of who does the individual billing.
And the reconciliation, as I understand it from what you said, lies with the carrier. The exchange doesn't have any obligation, legal, moral, or otherwise, to get involved in that process. Is that correct?
We are not involved in the reconciliation for the advanced premium tax credit. We will be involved in reporting our enrollment to the federal government and making sure our reporting matches that enrollment that goes to the carrier. So as far as the reporting goes, and that will fall on the exchange, but the reconciliation itself regarding the amounts that the carriers have received from the IRS and may be due back to the IRS due to retroactive terminations falls on the carriers regardless of who does the billing.
Unfortunately, you bring up another question. Now that we've done that and we're going to retroactively terminate or whatever, what about any of the, quote, excess fees that we've had to collect, tried to collect, or do collect from any of the insureds? The fees that go back to the exchange, how are you going to track those?
So our fees on the exchange and our fees to Xerox will also be on an incurred basis. So if there is a case where an individual is retroactively terminated, then we will adjust the fees to Xerox and we will adjust the fees that the exchange receives. I'm not sure, again, the workflows and the flow of money will be determined by this decision on the individual basis, but regardless of how that money flows, there will be a reconciled billing that we will administer and make sure it works.
Obviously, the devil's in the details, right, sir?
Absolutely.
Madam Chair, that ends my questions. I would call for the question, may we vote?
Thank you. I believe, you okay? One question from Ms. Parati-Boothman.
Thanks, Madam Chairman. This is Janie Parati-Boothman for the record. I feel engaged by the financial feasibility offered in this proposal. However, I was reading through Mr. Plain's letter, and I have one consideration with regards to those individuals that would pay by credit card, if you will, and that's the merchant fee, that if we so determine and approve the motion that Xerox continue forward with this, can someone speak to if this is common practice with this merchant fee, if it's acceptable, if there's room to renegotiate that, if we award Xerox that merchant fee is a little concerning.
Mr. Hager, I believe the merchant fee is through the credit card companies is the challenge right now.
Yeah.
But I believe from what Mr. Hager said that the Xerox and the Exchange and the Division of Insurance are still trying to figure out that part of the individual premium aggregated billing. Ms. Joyner?
I share that concern, actually, in reading the letter. The recommendation that I was going to make, actually, Mr. Hager preempted me, which was great. He said that we do have a bill draft request to make that an exemption. And so when I was looking at the letter, it talks about the precedent that in the past, this is how this has been interpreted. Fortunately for us, we do have a legislative session coming up. So I think that since it is state law, we can easily change that. And John can correct me, but my fears were alleviated when I realized that I actually pulled up the bill draft request and it's in there. So I think that can be solved through state law changes. Is that correct, John?
I appreciate Ms. Joyner's optimism about how easy it would be to change state law. So we do, in fact, have a bill draft request in that exempts the fees charged by the exchange from the premium tax calculation. In discussing this with the Division of Insurance, and I'm probably going to ask Adam Plain to come back up here, but there is concern about whether or not charging a fee directly to the individual would in fact be exempt from the premium tax collection, from the premium tax calculation. So I think once we make a determination, and maybe it's part of this determination of whether or not we do individual billing or not, the second question is the credit card fees and how we deal with that. So my understanding, and again, Mr. Plain can correct me, even with the statutory change to exempt the exchange, exempt the fees from the exchange from the premium tax calculation, there is quite a bit of case law that indicates that if we charge an individual directly for their use of a credit card, that information would have to be passed to the carrier and the tax would have to be based on that fee in addition to all of the other premium that they pay, except for the administrative cost of the exchange. If we absorb the credit card fee in the exchange's operational expenses and charge it to all consumers who use the exchange, to all carriers based on their enrollment of the consumers in the exchange, then that would be part of the exchange fees and would be in fact exempt from the premium tax credit. Now, it is certainly true that that we can request that we change statute. It's very difficult to determine whether or not that piece would be included, and we are somewhat at the mercy of the Division of Insurance. These are their statutes that we're requesting to change, and the rules of statutory construction means that they basically interpret their own statutes. I guess the question is, how far do we go with the bill draft request, and whether or not we would get support for changing that piece. It would certainly make it simpler if none of it was included in the premium tax. But I think Mr. Plain might be able to provide some historical information on why it should be or would be.
Thank you, Mr. Hager. For the record, Adam Plain, Nevada Division of Insurance. Mr. Hager's summation is pretty much correct. Over the last span of time, and I would hesitate to put even a time frame on it, the division has used its administrative regulatory process to very tightly control the fees paid by and charged to Nevada consumers by the insurance industry. I believe there was a trend at one point in time to, for lack of a better term, de-premium a lot of the cost of insurance and charge it as ancillary fees. And then the claim was that, well, those ancillary fees, since they are not premium, are not subject to the premium tax. And so the division has carried on for a long time of, those are premiums, they are considerations. The legislature has made statutory changes such that our definition of premium in the state of Nevada and our definition of what is taxable is very broad. and encompasses anything paid by a Nevada consumer in exchange for an insurance product. And so in discussing with Mr. Hager the technical aspect of these merchant fees, what we've kind of settled on to a certain degree is if a Nevada consumer is charged a credit card or merchant fee or some other sort of transaction fee to pay their insurance premium, it is considered a consideration for insurance under Nevada law and subject to the premium tax. If the fee is not passed on directly to the consumer in that fashion, but say absorbed into the exchange's operating costs and then meted out to the insurers through the per member per month financing cost, it's no longer a consideration for insurance, except to the extent that the insurers now build it into their standard premiums to cover that PMPM charge. The technical difference is if the exchange builds it into that PMPM charge, we can point directly back to it and say, yes, that is an exchange fee, and so if the exchange BDR is passed, that fees be exempted, there's a clear-cut definition for what is exempted. Without that clear-cut definition, it would be, I think, very difficult to craft statutory language to somehow exempt this merchant fee charged by Xerox on behalf of the insurers and the exchange and not create a loophole where other fees that we've fought so hard to deem as premium and deem as taxable wouldn't somehow end up start slipping through and have a regression in the way things have been handled here in the state.
Thank you very much. With that, I don't believe there's any other questions or comments. We have the motion and the second on the floor. Do I need to reiterate them? Are we all okay?
Okay.
All in favor, please say aye.
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 All opposed? No opposed. The motion carries. Before we get to agenda item 6 or 7, I'm sorry, I can't see at the moment. I do want to take about a 10-minute break, but I do want to thank everybody, public comment, everybody on the committee, because this was a new issue that was kind of tossed to us kind of late in the game, and I really, really appreciate everyone's time and consideration and thoughtfully going through this. And I know that the board is going to appreciate it because we went through it the first time last month. So really appreciate everyone's thoughts on this. With that, if we can take a 10-minute break, maybe that would be great.
So everybody, please be back by 3:45.
I'm sorry, we got a little distracted here. I'd like to go back on the record. It's a few minutes after 3:45. Ms. Lewis, are you still with us?
Yes, I am.
Excellent. I just wanted to make sure. Thank you, thank you, thank you. I'm so glad you're participating.
Yes.
Okay, Mr. Hager, are we ready to move on to agenda item 7?
Absolutely.
And I'm gonna, why don't you start? We do have some, I guess, comments and clarifications here about what was passed at our last meeting, which I guess I'm gonna start actually now that we're going, which I think I think we all agree that your one sheet updated summary of July 24th, 2012 is what was passed at the last committee meeting. So I think, does staff think that too?
Yes. Yes. So
Okay.
Yes.
I'll let you go. I'll let you move forward now. I think we just wanted a clarification here that that's what we are all working off of, and then we'll discuss all the documents, the changes today that are based on that, the Secretary of Health and Human Services letter, and all of that. So I'll turn over the floor to you.
Okay. So for the record, John Hager, I might input in the record an audible sigh. So this report, unfortunately, is a result of some miscommunication between the exchange and the Division of Insurance and the requirements for navigators. So what I'd like to start off with is the motion that was approved by the committee at the last meeting, just to summarize what has been approved by the committee. And that was a motion by Ms. Ellis, seconded by Mr. Downey, to allow producers to enroll in the Silver State Health Insurance Exchange to be licensed as proposed by the staff, that it says, and I quote, producers will be licensed in the same manner they currently are with the Division of Insurance. To allow navigators to enroll in the qualified health plans of the exchange and Medicaid eligibility, and to be trained and licensed by the DOI according to what our executive director recommendation was, in partnership with the DOI, that the new license will be created for navigators to meet the standards necessary, and to allow and approve assisters to be one additional category of education and outreach to be trained, tested, and certified by the exchange as proposed by staff. So when we were getting through, after this was approved, we had some meetings with the Division of Insurance, and the result was this document where we thought that we had to have individuals who work for a navigator entity who are producers. So the navigator entity would receive the grants, and somebody on staff would have to be a producer to be able to enroll individuals in that coverage. Since that time, since we provided this report, we've had additional discussions with the Division of Insurance, and they have indicated that the original proposal, as recommended by the committee to the board at the previous committee meeting, is appropriate for the role of navigators, and so the navigators, as indicated, would have either a new license or a licensing light or a certification that says that they're navigators. And we do think that it is important that there is at least a level of certification to ensure that consumers are protected and provided the correct information. So they'll have to have training and certification, but they would not have to have a license to the level that producers have. And I believe that was the intent of the committee and the recommendation of the committee. So with that, I would like to withdraw the report that you see updated August 24th on navigators, producers, and outreach specialists. The only change that I would like to submit to the board, and I don't think it really requires a recommendation from the committee, is that we change assisters to outreach specialists, because everybody was concerned about what happened to the brothers with the assisters. So there was obviously some confusion with that. I think outreach specialists makes it clearer. But other than that, the committee of the recommendation of the committee is what we intend to provide to the board. And I apologize for the confusion with this report.
Thank you, Mr. Hager. I'm going to bring up a question that I think is going to make everyone sigh as well. I apologize, but I just want to make sure we are on the same page as the feds. So in the letter from the sample letter, or the copy of the letter we have dated July 11th, 2012, from the Secretary of Health and Human Services to a member of the House of Representatives. She goes through in really very nice, for me, clarification of kind of what the navigator's role is or should be. Does our one-page draft go further than what is outlined in this letter, or do we think we're okay on this? I think we kept getting caught up in facilitate or enroll, and I just would like to know maybe staff's thoughts on that, and then maybe some committee members' thoughts on that. Just so I just want to make sure we're all on the same page, especially before we submit to the board for approval, because I just think that's the continuing complication, is enroll or facilitate enrollment, and I want to make sure that we're all on the same page. So, Mr. Hager, would you mind chatting first about that, and then I'd love to hear from the committee members as well.
For the record, John Hager. So yes, I do think that the committee's recommendation is in line with the letter from Secretary Sebelius and the regulations, and I might be speaking for the Division of Insurance, but I think they agree with that. Mr. Rich is up here from the Division of Insurance. I'd ask him to comment that whether they agree with the recommendation so far.
Thank you. Good afternoon, Madam Chairman, committee members. For the record, Todd Rich. I serve as the Deputy Commissioner for the Division of Insurance. First of all, I appreciate your time. I know you have a lengthy meeting today, but I thought it was important that the division comment on this issue because it's very important to us. We had a lengthy discussion with Commissioner Kipper earlier this week with our team, and we've had lively discussions with Mr. Hagar and his staff about this. And I think theoretically we are all on the same page, but I wanted to make a couple of points because Commissioner Kipper did feel strongly about this. The division feels that for the navigator, there has to be an appropriate level of training, understanding, and accountability. And we've got health insurance producers here, we've got navigators, we've got these outreach specialists. For the navigator group, we feel that a certification would be appropriate. We don't feel that they need to have the entire health insurance producer license education behind them, but they need to understand the process. And the division has already developed the mechanisms for certifying and identifying people that need licenses. We know how to do the education. So we've got that in place, and we feel confident that we should probably take that lead role in that. So I think, as Mr. Hagar identified, we are pretty much on the same page that the navigators would be licensed to some degree, but maybe we could call it a certification. We do share concerns that were brought up earlier about the call center employees and their role in engaging consumers that are purchasing a very complex insurance item. And I think we need to have additional discussions with Mr. Hagar and his staff on how do we ensure that these Xerox employees, which I have no doubt they'll do a great job, but if they're getting to the point where they've managed someone through this really excellent website and the person says, okay, I'm ready to make a choice, but I have diabetes, which plan should I pick? And I don't know if a call center employee should be making that decision for someone. So we really need to think through this process because the Division of Insurance is also the agency that will take all the complaints. If people have concerns about this, they will be calling our agency saying, this person put me in the wrong plan. What are you going to do about it? We are somewhat limited in our staff as far as our consumer services, so we want to make sure that whatever processes are identified are the right processes and Nevada consumers are protected and they pick the right plans. And so we've worked closely with Mr. Hagar and his team, and we will continue to. And I just want to make sure that what was in your report, that you understood that was not our position, and that we feel that what was said earlier is appropriate. So if you have any questions, I'd be more than happy to answer those.
If I might continue on.
Please.
So specific to the navigators, in our discussions this morning with the Division of Insurance, I think the consensus was that navigators can provide information and in accordance with the federal regulation provide unbiased information regarding the various qualified health plans, but that they weren't to provide specific advice, similar to what Mr. Rich brought up regarding the call center, that if you want advice on where to go, on which plan you want to take, you really do need to go to a broker. But in the situation where they're providing specific information, so I've got diabetes and what plan is best for me, the navigator shouldn't answer which plan is best for them, but rather these are the plans that have your doctors, these are the plans that have your drugs, these are the plans that have this various diabetes, a diabetes program, and all that information should be available on the website, but that they shouldn't be providing advice on specific plans. And I think that is what I heard from the Division of Insurance this morning, and based on the regulations and the letter from Secretary Sebelius, it appears that is in line. All of those recommendations are in line. I think that was a recommendation of the committee at the previous meeting, but I'm certainly open to correction.
Ms. Joyner?
I actually did have a couple of questions in light of the Secretary's letter, and I wrote down 3 different areas that I think may need to be clarified, at least in my mind. Under the proposal that navigators be licensed by the Department of Insurance, in the Secretary's letter, I think it makes it very clear that these people are not brokers or agents, and in fact, there's a line that says the exchange develops the training standards, and then they're listed. So it's not clear to me why the exchange would establish their training, but then not be the one that certifies or licenses them. And I know that in our previous conversations we did talk about the exchange being the one that licensed or certified the navigators. So I thought that to clarify in light of the Secretary's letter that it would be more consistent to change that they be licensed by the exchange. The second thing that concerned me was I think the letter also makes it clear that they're facilitating enrollment. In fact, all of the federal things that I've seen use the word facilitate enrollment, and I think here where it says enroll, that's where we're getting, I think, confused, where we say, oh, they're enrolling people, therefore they need to go through the Division of Insurance. If they're facilitating enrollment, I think that is more consistent with what the federal law states about navigators. The third thing that actually isn't related to this federal letter, but it's related to something that I was trying to find in the federal recommendations, is relating to whether providers, clinics, and hospitals can be navigators. And we've received a lot of public comment suggesting that that's where our people are going to be in the most need, is out in the federally qualified health centers. And so it's, in my mind, and I stated this at the last meeting, the way that is phrased does not preclude providers. And so I think it's a state's interpretation. And I guess what I would ask is, we've been told time and again that it's a federal interpretation that there be this line. But I'm looking here at the language again. It says, a person may not receive consideration directly or indirectly from any health insurance issuer in connection with the enrollment of an individual or employee. And to me, that's different from being reimbursed for services. So I guess we can go around in circles talking about what the federal interpretation of that is, but my request then would be that we say something like, if we think it's a good idea, we say something like, it's our recommendation that providers and clinics and hospitals be allowed to be navigators if federal law allows, because we know very well that the interpretations and regulations will continue to come out. But I don't think it would be out of order for us to say something like that, just considering that more clarifications will be coming down from the federal government.
For the record, John Hager, we've had some conversations regarding this with the federal government, and the initial indication is, in fact, your interpretation that that navigators may be allowed to be providers. We haven't gotten anything in writing yet, and that's where they get a little more cagey. What I would say is that the recommendation would not necessarily restrict who the navigators are, that we use the federal interpretation of what navigators are, and then that once we get guidance from the feds in writing, that we'll be able to say, yes, in fact, they can be producers, or no, they can't be. But I'd like to have that in writing from them, just to be clear. But you are correct. As of this point, it appears that our initial interpretation was incorrect, and that the providers may be allowed to be navigators. Again, we'll get written confirmation from the feds on that one.
Thank you. And I guess, let me have the other committee members speak first, then I will. Ms. Party-Boothman?
Thank you. I'll be quick. Gina Party-Boothman for the record. Thank you for quantifying that. I agree with that third statement. When I consider the populations that flow through the hospitals and acute care facilities and other facilities that are without coverage, and the potential for these facilities to provide at least outreach specialist or navigation skills in that acute care setting, it's paramount that and I hope we get clarification on that statement through the federal government.
If I might comment on that.
Thank you, Ms. Ellis. Yes, please do.
I think it is important to point out the difference, very briefly, the differences between navigators and outreach specialists. There are very specific regulations regarding navigators. There are not necessarily specific regulations regarding outreach specialists. We cannot get Affordable Care Act grant funding for navigators. We can get Affordable Care Act grant funding for outreach specialists. There is nothing that I've seen that prohibits an outreach specialist from being a provider or any other entity. We would obviously contract with them to make sure that they're going to do the job that we request that they do. But from what I've seen, there is no restriction that providers not be allowed to be outreach specialists. And again, we'll get the clarification on the navigators and providers.
This is Amber Joyner for the record. Thank you for that, John. And I do like the idea of the outreach specialist. I think my concern is that I want us to get the navigator definition correct. I want them to be able to have that full ability to help people because based on the proposal that I know you're saying is being rescinded, but based on the proposal that I saw for the funding, it looks like the outreach specialists go away in 2014. There is no money for them. So if the navigators are the ones that are going to continue to be funded, I really want them to be the ones that have the full ability to be in the community. Although I do appreciate the outreach specialists, and I'm sure they will play a very important role, I'm concerned that because they are not a legal entity in the federal law, that they are not going to be funded in the future once the establishment grant is gone.
Ms. Ellis?
T.B. Ellis for the record. I just have a question for clarification as we now are rediscussing the model of certification or licensure for the navigators. So when the DOI licenses brokers, these are individuals who become licensed brokers, and please correct me if I'm wrong, do they also license companies or organizations as brokers or just the individuals?
I'm going to ask the Division of Insurance to come up here to respond to that.
Adam Plain for the record, Nevada Division of Insurance. The division currently licenses both. An individual can be licensed as a producer. An entity would have something like a managing general agency license or some other entity level license, but underneath that they would still have at least one licensed producer.
Thank you. Then the Silver Insurance Exchange will have the opportunity to also do both certification or licensing, whichever term we want to end up using. Certifying or licensing organization, which one of them, at least according to Secretary Sebelius, have to be a nonprofit, and also license or certifying the individuals, either employed by those organizations or individuals that want to be navigators. So I just want to clarify that, in the previous meeting that we had, now we are talking about a totally different scenario because of the communication from Secretary Sebelius that perhaps this certification or licensure is going to have to be according to the final rule provided by the Insurance Exchange and not by the DOI. And if we're going to do it by the DOI, then can you tell us the reason why not do it through the exchange, I guess, and then what the difference is between the organizations and the individual certification for navigators?
This is Lynn Atkins. I actually would like to comment on that and also ask a question because I have similar questions. It sounds to me like what we could do and what I'd like to do is have the exchange come up with the certification requirements for navigators, but then the Division of Insurance can monitor and implement and do what they will. And I understand that we're all working in partnership with each other, but I would like the exchange to have a active role and voice in deciding what those certification requirements are going to be. And I'm just using the word certification because I think it does sound different from licensing, which is what the brokers or producers will be. So I see it, or I hope, that the exchange will have a strong recommendation about the certification requirements for navigators, and that the Division of Insurance would be the manager or implementing those. Mr. Hager or Division of Insurance?
For the record, John Hager. So similar to the way we contract out the call center and the IT system to Xerox, we can do the same thing with the Division of Insurance and still have it under the umbrella of the exchange. So I'm not concerned. I don't think that we need to be concerned specifically by who does the certification, as long as the exchange is part of that process of part of creating the process. I do agree that we need to make sure that that the exchange works with the Division of Insurance on the certification standards and training standards. The part of allowing the Division of Insurance to do the certification and training kind of goes with the idea that you outsource to the individuals or entities that have the expertise, and they do that already with producers, so they could probably do that with very little adjustment for the navigators. But we would certainly be part of that process. And the Division of Insurance has just come to the table, so maybe I said something incorrect.
For the record, Todd Rich. No, I agree with your assessment, and I think with the comments being made by the committee, we will work collaboratively with the exchange staff in developing what needs to be in this training and the certification. I don't think we could do it on our own, quite frankly. And the other thing I failed to mention is on our producer license for the life insurance side, or excuse me, the health insurance, we want to include some new requirements so that a producer will be well versed in the exchange model and they can speak to it, so that they won't have to get a separate license, that they can have one license that allows them full access, so to speak. But no, we will work collaboratively with Mr. Hagar and his staff to ensure that the training and the certification is appropriate. That's our desire. So however we get there, we're somewhat flexible, as long as it is kind of going back to my original statements, that there's accountability and there's education, and that if there is a bad actor, we can hold them accountable, because that's our biggest concern, is ensuring the rights of the Nevada consumer.
Madam Chairwoman,
thank you.
Adam Plain, for the record. It's also important to note that the selection of a navigator, as the division and Mr. Hager and staff have envisioned at this point, is really a two-step process. So not only would a navigator get a certification from the division as having completed the requisite education and training, but the exchange still has the ability to enter into a contract with that navigator. And so in effect, anyone who passes the test can be certified, but the exchange still has the veto power as to who becomes a navigator or not, by way of entering into those contracts.
Thank you. I would say most of the group down here is liking what they hear, so I thank you with that. Mr. McCoy, did you have a couple of comments or questions? I didn't want to leave you out.
Since Mr. Rich and Mr. Plain are here, this may not be meaningful, but I'll ask it anyway. NRS 683A201 talks about if I sell insurance, and it's always been a hang-up for me because I never viewed the navigator as selling anything. But in Chapter 683, there are exemptions from licensing. Do you see the need for amending NRS 683, whatever that section number is, in light of what we're talking about?
For the record, Adam Plain, in response to your question, I don't believe it's necessary. The exemptions from licensure exist only insofar as those persons are engaged in the business of selling, soliciting, or negotiating insurance. And based on the definitions for those three terms, we believe that if a navigator is offering advice on coverage availability, a plan or a product covers this pharmaceutical or covers this service, that is not any of those three, doesn't meet the definition for any of those three terms. So a carve-out or an exemption isn't necessary.
Okay, good. Just a couple of comments. One is a few meetings back we voted to avoid the two-step process. So whatever happens with the outreach specialist, I hope that we don't see a stop and then go somewhere else type of situation emerge from that. And then the other, I've made this comment every meeting that I've been in, and that is that our navigator really needs to have the understanding of chronic disease. We've got people that have a couple of chronic diseases they're working with, and if nothing else, I looked at some of the plans that are proposed that the plan committee was maybe going to look at today, but the meeting was rescheduled. And if you take a look at some of the plan breakouts, let's say I have a mental health problem, 12 visits, that's it. So if you've got somebody coming into the exchange, and the navigator is going to have to talk in terms of, get a little history of what's going on. So I think that there needs to be some flexibility, John, in terms of this navigator really achieving the purpose of why it's in the Affordable Care Act. That goes beyond probably what the typical provider producer is engaging in. And so I would just suggest that, as I have brought up each time, that we have a means for the navigator to be able to discuss, not necessarily recommend, but discuss the various aspects of the plans and the limitations on those plans. Once we have our QHPs in place, we'll have a better understanding of that. But I looked at one referencing 12 visits for mental health, and if I have a mental health problem, that's not going to cut it.
Thank you very much. Mr. Mazzoni?
Dwight Mazzoni, for the record. Mr. Hager, first question. Page 2 of Ms. Sebelius' letter states that encourages states to develop conflict of interest standards to give consumers recourse if they have been negatively affected by the actions of a navigator. I'm sorry, I read English, but I'm not sure what the heck she was saying there. What is a conflict of interest referencing if the navigator gave bad info to an insured?
For the record, John Hager.
You may not know.
No, I think there's two different. They're talking about two separate things there. The conflict of interest standards, I think that is in relation to the navigator not receiving any direct or indirect consideration for, direct or indirect consideration from carriers, which I think is separate from the recourse item, and we will certainly work to ensure with the Division of Insurance that the proper procedures are in place to address malfeasance or incorrect information by the navigators.
While I won't want to argue with you, it's the same sentence and they follow each other in this particular letter. I would
Where is
ask
it, sir?
respectfully. First, full paragraph, page 2 of the letter to Adam Kinzinger. The last sentence.
We will work
I would just
on
ask for clarification from from her office or HHS or whoever the heck we can get this stuff from.
We will do that.
Thank you. I guess my concern is, and it's been mentioned several times, and this letter even mentions it, is and the Department of Insurance says they don't have the people to do consumer services and such, and we can't, there's no recourse to me if I've been given bad information by a navigator or an assister or outreach, whatever it is. I have no recourse. I mean, there's nothing for me to go back to and say they said I should go in this deal, and it becomes, well, I never said that to the patient or to the client, and the client said, yes, you did, that's why I picked this. I have concern that while we're trying to create somebody that's not going to give their opinion, I guarantee you, and I have people in the room that would stand up and testify to this, that even currently within state programs and other voluntary programs, people give their own opinion. It's natural. You can't ask people to do the job we're asking them to do without having them give their opinion, and there's no way to control this. And I understand that. I'm not trying to fight against what this is, but somehow within the way we build this, and if I read this letter and several other things that we've, the reams of paper that we get, somehow the navigators have to have a line which if they cross that line, that's enough. I mean, they have to be stopped. And I don't care whether the navigator is a doctor's office, a hospital, or one of Peggy's people from her organization, which I think we need. It doesn't matter. And to add fuel to this fire, I'll tell you what, if you want to have a navigator in my doctor's office, you're going to play hell doing it. They may be able to say, here's the forms, go there, get online and do it. Whereas in a hospital setting, I think it's going to be a little different because they have people that actually help people get enrolled in plans or work with people to get enrolled in plans. So I have a very big concern as we develop this, that we're trying to give the navigator this great big role, or allow them to do things that are going to be way beyond the scope of what I read from the HHS and many of the other states, unless we get some different enabling legislation, which I don't know that we're going to get, that we're going to put ourselves between a rock and a hard place when it comes particularly to navigators. And there's going to be some situations arise that are going to be very, very tedious for us to deal with. On top of that, and this is an issue that from my profession that we're looking at, if a navigator talks to somebody and they give advice, and then they do what we might think from my end of it, the advice is, gee, I've taken you as far as I can, go talk to this insurance agent, or go get a broker, or go talk to your friend, whoever is legally qualified to sell you a plan. And they go there and they buy the plan based upon input from a navigator and now input from an insurance agent. I know where the liability lies, and it doesn't lie with the navigator, even if the navigator did say something that wasn't quite right or whatever. I don't know how to solve the problem. That's my problem, because I want to have the navigators do their job, but I don't know where we can start, where we build the box for the navigator, where we build the box for the outreach specialist, and where we build the box. Well, I pretty well know where the box is for the agents, but that's a different argument here. And I have grave concerns about that. I do agree that the navigator and the outreach specialist need to be certified. I would prefer, and I don't have any allegiance to the DOI on this, that be an undertaking that's primarily driven by the exchange somehow ultimately, and that the DOI simply be a monitor for that, not a creator of the program. Because if I was on the DOI side, I'd want to create it to look like an agent, and that's not the purpose here. I think we need to keep sort of an arm's length between that entity, the bureaucracy of that, and what we're trying to create here. I would caution everybody, including my own group, that we can't have our cake and eat it too. We got to figure out how to split this up and make it work for everybody involved. And there's more than one way to skin this cat, but I have grave concerns that we're trying to jump into some things, and I hope we don't get pushed to make decisions about particularly this aspect of it before we really have time to get through and get some of the details and the research done. Thank you.
Thank you, Mr. Mazzoni. And I guess, John, I don't know if you want to respond to any of those things. I mean, I guess I would just make two comments. One is, I think at our last meeting, we've set up the boxes that you're describing, kind of the best we can with the information that we're given. And again, I just continue to go back to the fact that the Affordable Care Act was passed with navigators in mind as far as driving the entire Affordable Care Act. And so, we know there's still a lot of discomfort with maybe that issue, but it is the fact, and I think this letter helps clarify that, and I'm actually feeling a lot more clear on this, even just as time goes on. So personally, I'm feeling a little bit more clear on it. Mr. John, did you want to comment to any of those things or no?
I think the only thing I'd like to say is that we share Mr. Mazzoni's concerns. I believe the Division of Insurance shares those concerns, and we will work with the Division of Insurance to create a better sandbox and make sure that that the rights of the consumer are taken into account, and we don't create a situation or we try to minimize the potential hazardous situations that we might encounter. So we do share your concerns. We will work to the best of our ability to make sure that that line is as clear as possible.
Thank you. Mr. Mazzoni.
I'm just trying to draw on experience, and maybe some of this is valuable, maybe it isn't. And we have at least one other person in the room that could speak to it if we need to. In the senior market, aside from having to have about 45 to 60 hours of education that we have to pass, including a test from a national organization called AHIP, we also have to suffer under, with, or whatever mystery shoppers, ghost shoppers, and stuff like that. Is there any intent in your mind, sir, that and this is for everybody involved, navigators, producers, everybody, is there any intent or idea that there would be some sort of a monitoring situation set up so that people who are going to be involved, be a navigator or be an agent, a producer, would be having to look at some of this, or having to be viewed and checked out, make sure they're doing their job right, I guess you might say?
Yes, and I believe in both the document that has been approved and the document that we are withdrawing. We indicate that there will be a monitoring process. We have not yet defined what that monitoring process is, but we do agree that there needs to be some monitoring process to make sure that they're staying within the lines.
John, and I guess Xerox would be the best person to respond. You'll be recording calls at the call center, correct? So there will be ongoing monitoring.
Jennifer Wadham from Xerox for the record. Yes, we have ongoing monitoring of calls and screen capture so we can see what they're doing.
Thank you. Mr. Downey?
Thank you, Madam Chair. Randall Downey for the record. I'd like to respond just briefly to Mr. Mazzoni's comments. And I think that when the Affordable Care Act was written with navigators as a central portion of that, with the exchanges to help the uninsured become insured, they were drawing very much on a very successful program which has worked in the Medicare program and which exists in this state, the SHIP program, where the navigators, so-called, the counselors with the SHIP programs nationwide are certified by Medicare or monitored by Medicare, and they have done an excellent job of helping people find enrollment. So I think we have a proven track record, and I know I take your fears and your concerns seriously, but I think we have a track record, and that Congress had a track record from which to draw when they framed the legislation. So I think we can move forward on that issue. I very much appreciate the comments by Ms. Joyner and Gino over to my right here, and I think that, as well as those by the chair, that we've kind of put to rest and we've come to clarity, if you will, as to what
the conference is about to end.
Oh, it is not. And the outreach specialists, what their functions are and their roles might be. I think, though, we've raised some issues here today, and I would really hate us leave this room today. So I would like to, I'm not making a motion, I'm not moving anything, but I think we need to come to some agreement or a sense of the committee that call center staff must be certified as navigators, and that providers should be treated, if they approach the exchange to become navigators, they be allowed to do so unless future federal law then prohibits their participation. And if it's in order, I will so.
I don't want to entertain a motion at this point. Okay. I don't. I think the second comment that you made, we don't need to vote on. because I think, as discussed, we're going to, once we define our navigators, and then we're going to have the navigator grant program, and I think that will start defining a little more clearly who can apply and who can't. And as Ms. Joyner and Mr. Hager were discussing, I think we're still waiting for some guidance on the federal guideline. I think if the committee feels it needs to make a recommendation regarding the call center staff as navigators, I think we could do that. I was leaning a little bit more towards I didn't think we needed to vote on anything regarding this today, but that's where my head is.
Madam Chair.
Yes.
Okay, so first of all, other than the call center issue, I think all of the concerns of the committee have been addressed in the previous recommendation from the committee, so I don't think that a motion is necessary to move this forward to the board. We do share your concerns about making sure that the navigator has the appropriate amount of training and certification, and we will work with the Division of Insurance to make sure that happens. As far as requiring the call center representatives to be certified navigators, we need to work with Xerox on that and discuss whether or not there are contractual issues in that. But we do agree that they need to be fully trained and able to answer many of the questions, if not all of the questions. So let us get back with Xerox to talk about whether they need to be certified as a navigator before we start moving down that path. It would help us to have those offline discussions first.
John, I appreciate that, Lynn Atkins. I would ask, though, I think the committee here, though, is very interested in being part of the certification guidelines for navigators. So I would ask that whether it's at our next meeting or the following meeting, whenever we're kind of starting to get up to speed on that, that be something that be brought back to this committee.
We can do that. Probably would be brought back in the October meeting. It's going to take some time to start getting that together. It may even be later than that. We've got plenty of time for this program, so it's not a rush. So if we don't even bring it back until November, that would be okay. And before I stop talking, we are almost out of time. We've been told that we can't continue past 4:30. We might be able to take a few minutes past that, but I think we might have to defer the appeals item for to the next committee meeting.
That's fine. I think we've actually solved a lot today and gone through a lot. So if we could put the appeals on, I'm also, and I don't know if it's better off for the board meeting, as we've been talking a little bit offline, I'm concerned about the budgeting and the amount of money that's being allocated or proposed for outreach specialists and navigators, and I'm concerned that we're not going to have the infrastructure, as I've discussed earlier, to kind of handle the volume, especially during the first enrollment in 2013. So I'd like that to be somewhere, either on our next agenda or on the board agenda.
We can do that.
So if we are running out of time, so we will put item number 8 on the next committee meeting, and then I would need to take public comment before we close. Any public comment in the South? We have public comment. Please state your name and your organization for the record.
My name is Peggy Mays Johnson. For the record, I'm Executive Director of the Consumer Assistance and Resource Enterprise. I have lots of comments, but one, in looking at the outreach specialist, it seems to me that this is something that is in the line of the Silver State Exchange as far as staff. When you're talking about $75,000 and $135,000, I mean, that's